അത് കണക്ട് ചെയ്ത്
ജയന്തിക്ക് അവിടെ ഞാൻ സപ്പോർട്ട് ചെയ്യാനിരിക്കണമെന്ന്
Ma'am, now you can start the session.
Good afternoon, everyone. Welcome to today's webinar, De-Stress, Let's Talk on Mental Health of Nurses in COVID-19.
Madam, please unmute yourself. Please unmute.
Happen. Sorry for the interruption. Senior nurses, during their briefing sessions, they expressed that they are experiencing extreme stress during COVID-19 stress. They identify the stresses as managing manpower resources, logistics, finding accommodation for facilities for staff in quarantine, capacity building for various categories of staff, setting up intensive care units within a small time frame. Patients become positive in general ward in non-COVID area. Large number of staff members getting exposed to infection. Too many admissions. Managing COVID and non-COVID patients in one hospital. Unique needs of each patient like NRIs without having any SIM card to call their relatives in Kerala. Mother and child getting admitted together. Nurses in COVID isolation ward and ICUs expressed physical and mental stress due to illness anxiety because of the rapid and extensive spread of novel coronavirus. Exhaustion from long working hours in PPE without taking food and fluids, not using washrooms, especially women, frequent changes in protocol that are not communicated down to all providers, excessive perspiration due to PPE, time-consuming donning and doffing process, inadequate staffing and too frequent posting in COVID area, staying away from loved ones, lack of appreciation and recognition, heavy toll on physical and mental health. Postgraduate students in home quarantine shared uncertainty and extreme stress. Nurses are not recognized and acknowledged properly. Issues are not addressed properly, even though they are a major force in the health system and in this pandemic containment. Hence, an urgent need for safety and well-being as a top priority in pandemic management. Stories and experiences of nurses in COVID-19 response inspire us to come forward. Current support services are not tailored to address the unique needs of nurses. Many of the things which we do to lift our spirit are not possible now because of the lockdown. Current crisis represents an opportunity to shine light on the long neglected areas of nurses' mental health and well-being. Thus, the webinar, De-Stress, Let's Talk on Mental Health of Nurses in Corona Pandemic. We are lucky to have a team of eminent panelists from India as well as other countries. Warm greetings and welcome to all the eminent panelists and Madam Dr. Leda R, Joint Director of Nursing Education, faculty members, colleagues, students, and friends. Let me introduce the panel. Dr. V.K. Shamir, Assistant Professor, General Medicine, former Nodal Officer of COVID-19 Pandemic Containment Team, and also NIPA team player. Dr. Roy K. George, Academic Director, Principal, TNI National President, IAC member with more than 3 decades of experience. Dr. P. Krishna Kumar, Director, Institute of Mental Health and Neurosciences, IMHANS, Kozhikode, with more than 20 years of teaching experience and 30 publications in index journals. Dr. Pradeep Nair, Educational Coordinator, King Faisal Hospital and Research Center, Riyadh, Saudi Arabia. He is a recipient of many awards and accolades, having experience in 3 foreign countries and in India. Mr. Rubland Anand, PhD Scholar, School of Health, Federation University, Australia, recipient of the Australian Government Research Training Program Scholarship. Both these members are alumni members of Government College of Nursing, Trivandrum, and they have achieved greater heights in their profession. Mr. Anish Kumar K, Assistant Professor and Nodal Officer of COVID Containment Team, Government College of Nursing, Kozhikode. He is also trained in disaster management. Dr. Reena George, Assistant Professor and Head Psychiatric Nursing, IMHANS, Kozhikode, having more than 70 years of experience, both clinical and teaching experience. Mrs. Jayanti Ammar is the coordinator of the program. She is specialized in psychiatric nursing, working as Associate Professor. Once again, warm greetings and welcome to this webinar. Now, Professor Dr. Leta R., former Joint Director of Nursing Education, who was coordinating the activities of the COVID containment team of nursing colleges as well as the nursing service department. Over to you, ma'am, for the inaugural address.
Thank you, Professor Panuma. Good afternoon, everybody. At the outset, I wish to congratulate Professor Panuma KM for selecting this topic, which is very apt for the time. And it is very glad to see that we have very eminent speakers from home as well as overseas. And some of them are our alumni, which is very great because there will be an open sharing. I am sure that this webinar will help us to share a lot of experiences and help us to plan well ahead so that our nurses' burnout could be reduced. As we know, nurses in general experience immeasurable stress. Now it has intensified with COVID-19. Now I feel that Kerala had little bit of time to prepare ourselves because it suddenly appeared in the world, COVID-19. And because of our previous experiences fighting with severe infections earlier too, we were a little bit mentally prepared. Calicut is a good example for that. And we could prepare our nurses also. Kerala is, we know, famous for viral infections. We get one after another. Therefore, it had been felt that we have to be prepared. Nurses have to be prepared to combat this. It was started years before by Directorate of Medical Education, the previous joint directors, especially Professor Prasanna, who had started intensive training for nurses, especially infection control. So we had a group of infection control nurses who were the leaders, I'll tell you. But myself, who followed Professor Padma, could equip and empower our nurses little more in anticipation of some kind of infections. And we had master trainers for infection control, and 23 are there distributed throughout Kerala. They are the leaders, I feel, in this corona period. Now, with this mental and little bit of physical preparations, we started fighting COVID-16. Sorry, COVID-19. Now, worldwide, we know that nurses are in the forefront as care warriors. And we are doing it wholeheartedly with our heart and soul. We're trying to do whatever is possible by us and for the people of the whole world, because Kerala nurses are present everywhere, omnipresent. Now it's known that nurses are the only one major category of healthcare personnel who spend 24 hours with the patients. In the care unit, they are with the patients throughout, and maybe in the wards where positive cases are admitted, we may not be present 24 hours, but with them in close contact, but we are present in the ward or in the area, in the unit. Now, because of this prolonged contact, close contact, and frequent contacts. Why frequent contacts? Professor Palama has said that due to shortage of staff, very frequently they are being posted to these areas. There is a high risk of getting infection. Though we have adequate preparations by means of training, without enough facilities, for example, PPE, we cannot remain safe. Then added to that, we have a lot of queries and frustrations related to the outcome of COVID-19. Now it is, WHO has declared that it is an airborne disease, and for 8 hours, the virus will be present in the air. So boldly, we have to tell others, teach others, and practice wearing masks. And when we are in the hospital, use of PPE. And there should not be any breach of use in PPE. Breach in PPE use will definitely take us to infection. There is no doubt. Now, all this lack of a favorable environment to work and other emotional or physical form of stress definitely has led nurses to severe occupational stress and burnout, severe burnout. But we often find it very difficult to express because this is our role. We are like shock absorbers. We have to take everything, handle them, tackle them. But we do learn. We just say that nurses are able to stand in their own feet. They are very bold. They are able to rise to any difficult or critical situations. That is very important. Now, of course, the COVID-19 situations are not very favorable. We get massive admissions. Sometimes more number of patients will be very sick, critically ill, and sometimes we just lose their lives in front of us. We lose them. We remain helpless. And though we know that we have to do prioritization and planning and all, in COVID-19 situation, very often the practice is restricted. We are not able to plan for the patients as we wish in giving close patient care. Then lack of facilities is one of the major reasons. No, we just cry over that PPE use. So what we did is practically we taught them how to economically use, safely use, and cost effectively use PPE. And we can just I think we have succeeded in to a certain extent in all these things. Now with the increasing volume of work, increasing duty hours, nurses are physically also tired. They are mentally exhausted, physically tired. And there is a lot of discrimination also. This is experienced and expressed by nurses. We are sidelined very often. They're not being appreciated well for the services. We don't require always because it's our duty, but still, on special occasions, it is required to improve the morale of nurses. There is no doubt. And often they suffer from, I'll use the word suffer from lack of support. The support should come from our administrators, immediate supervisors, our colleagues or friends or family members or the community. We nurses lack that very often, most often, I'll tell you. And whatever work we do is not being acknowledged. There is no record of work done by nurses. I have personally listened to Professor Pannamma sharing a lot of experiences of nurses in Calicut Medical College, how they prolong the life of patients by bringing food and fluids and all prepared at home for patients depend on patient in the NG tube feeding. A lot of things she has also shared. I think she has such a treasure of experiences shared by the nurses of Calicut Medical College. I do have many because nurses used to come to me and share all these experiences from Trivandrum Medical College. And sometimes I feel that though we have a lot of associations or organizations where the nurses are members, don't receive enough support. Like I often feel jealous of the doctors because they have a strong umbrella of IMA. All the doctors are protected by IMA somehow. And ethically and morally, they just belong to that IMA. But we nurses, I sometimes doubt whether we get such good support, strong support from associations. They are trying, I know our professional organizations are trying for that. Anyway, I guess the stress experienced by the nurses and various sources of stress were very beautifully depicted by Professor Pannamma in her slides. Now, I wish to share 2-3 points which might improve the mental health and tolerance power of nurses, I feel. One is the teamwork. The nurses are most important members of teamwork. We are in the pivotal role. Without us, no healthcare facility can function. That is sure. The nurses should feel proud of that. That is a strong point as far as nurses are concerned. So the team, that the feeling that we are part of the team and one of the most important and strongest member of the team is always good. So that we support each other, we appreciate each other, we just bring out the good work of everybody, the whole team. And the support should not only be from my own friend or my colleague, it should come from our administrators or supervisors. Just a word, I have done a good job. The patient was saved just because of your timely action. Such things should be said. We have to teach administrators to express good words and to appreciate the nurses or the colleagues working with them. Then a practice, definitely a positive practice environment, which we have to create. It will not come to us, but we have to create. We are responsible for that. And the time factor is very important. Now, Corona just suddenly appeared in the world to us. It came and we were shocked in the beginning. But we had some time. Time is an important factor for people to make adjustments. Now we have a lot of nurses from different background, different capacities, and their ability to just get into it, get out of it is different. So we have to give them little time to get adjusted to the situation. And a lot of guidance, counseling is required, and a lot of stress relieving measures. We have lots of experts from the field of nursing and allied disciplines. And I'm sure that you will be sharing a lot of your experiences and just showering with a lot of stress releasing measures for nurses. which they are just waiting to listen to. With this, I won't take much time because the speakers are more important for us. I just wish to tell you the most important message that nurses are providing selfless service to the community. At least we have to acknowledge that wherever we get an opportunity to praise them and bring it out to the public through media or any other sources, the services rendered by nurses, the selfless service rendered by nurses. So with this, I declare this webinar officially inaugurated and open this platform for deliberations by different eminent speakers from Kerala and outside India. Thank you.
Thank you, ma'am, for the supportive and insightful speech and the inaugural address. Thank you very much. Now, I invite Mrs. Jayanti Amar, Associate Professor, Psychiatric Nursing, to chair the session.
Hello, everyone. Good afternoon. Myself, Jayanti Amar, Associate Professor, Government College.
Jayanti madam, now you can talk.
Okay, thank you. Hello, everyone. Good afternoon. Myself, Jayanti Amar, Associate Professor, Government College of Nursing, Kozhikode. Welcome to the webinar on mental health of nurses in COVID-19. For those of you joining us online, welcome. The webinar is hosted by Government College of Nursing, Kozhikode. Before we start, may I remind you that if you have any questions during the presentation, just write them in the chat box. So we will discuss the questions during the Q&A session. Thank you. This webinar is streaming live on YouTube and official website page of Alumni Association of Government College of Nursing, Kozhikode, and the link is available in the chat box. Okay, we can begin the session. COVID-19 pandemic took us all like a wave. The novel COVID-19 pandemic is considered the most deadly compared to other previously occurred pandemics. How is COVID-19 pandemic different from the other outbreaks? Our first speaker, who will expand on this topic, is an eminent physician from Government Medical College, Kozhikode, Dr. Shamir Vike, Assistant Professor and Nodal Officer for COVID-19. He was recognized by Kerala government for being a part of management 2018. I welcome you, Dr. Shamir.
Shamir sir, you can now.
Yes.
Thank you.
Okay. Good afternoon. Am I audible?
Yes, sir, you are audible.
Okay, thank you. So good afternoon all. And first of all, let me express my gratitude for giving me such an opportunity in a timely webinar based on a very important issue, the mental health issues of nurses. As I was listening to our beloved madam inaugurating the session, the nurses not receiving the appreciation or support. It's a real issue, and being the nodal officer of our COVID Center of Calicut Medical College, I was witnessing the struggle and the hard work done by our own nurse fellows. And if I am asked to pick a single profession on earth, with how hard it is, nurses who serve, not even in their duty timings. I could see them. I could running round the clock for conducting such a treatment center in our own hospital. So let me go to the topic which is given to me, that is the COVID-19 differences from other pandemics or epidemics. So before going to the topic proper, let me just refresh the few words with regard to the topic. That is, these are very common words which we often use, but just for a recollection, what is an endemic? Endemic is a disease that is constantly maintained at the baseline level in a particular area. For example, a dengue fever in our district, if it occurs around 100 or 150 cases every year, we call it as an endemic here. And suppose the same disease occurs in large number, but it is restricted to the same community or region, then we call it as an epidemic. For example, the same dengue fever, if in this season it comes in thousands, we call it as an epidemic. But again, it is restricted to the same region or the community. And we call it a pandemic when this epidemic crosses all the boundaries. It is spread over multiple countries or even the continents. So an epidemic which travels all over the countries, then we call it as a pandemic. So these are the simple things which we are very familiar. And ever since the human started its existence on earth, we were always challenged by so many infections, so many epidemics, pandemics. We were challenged throughout. And we know from the history, when we read our histories or novels or textbooks, we come across a lot of pandemics like cholera, smallpox, plague, etc., etc. And I'll be just rushing through some of the pandemics which challenged us in the last century. In the beginning of the last century, the most important epidemic which challenged the human existence was the Spanish flu. In 1918, it affected almost around 500 million people. And you can see in yellow letters, that is the number of COVID-19 patients just taken yesterday. It might have increased now over this one. And it caused around 550 million deaths on earth, but it's not an accurate data because it occurred around 100 years back. The data and statistics were not that accurate as the times now. So it is expected that around 50 to 100 million deaths were due to Spanish flu. And almost 1/3 of the population on earth was affected by Spanish flu in 1918. And the mortality, an average mortality calculated is around 2.5%. And the big event occurred. We will be surprised why 100 years back, there was no much travel or flights or train services like our time, but still how this infection could travel all over the countries or continents, the answer was the war. The people used to travel, the soldiers used to travel across the countries, and they took the infection all over the countries, and that led to the pandemic of Spanish flu. And if you consider the symptoms and signs or complications and modes of transmission, it is almost equal to our COVID-19. It's again a respiratory virus. The main symptoms are cough, fever, and all the upper respiratory symptoms. The complication was pneumonia, and the mode of transmission was again through respiratory secretions. So almost very, very similar to our COVID-19. But a very important difference from COVID-19 was a high mortality in young people. The Spanish flu had the maximum damage on young soldiers during the World War. So that was about Spanish flu. And then there are a lot of epidemics and pandemics of cholera. And the 7th pandemic of cholera occurred in around 1961. And we are very well aware the mode of transmission is entirely different. So the prevention of cholera is easier compared to COVID-19, provided people are having a good and the science evolved new treatments, and ORS was a benchmark in the development of treatment. And the science evolved, a lot of new treatments came, and ORS was a trench. So it is no more a big issue for the present population. And in 1981 came a new infection. It was an emerging infection at that time, and it affected almost, it caused around 32 million deaths on Earth. And this HIV, when it came in 1980, it was such a dreaded infection. It made people suffer a lot. Made people surrender to a lot of infections and finally succumb to death. There was no answer, and we were actually threatened by such. We can see around 37.9 million people are living happily with HIV. And the unique mode of transmission made it a preventable disease, and the science emerged all through these years. A lot of drugs came, and HIV is almost a controllable, even up to a level of a disease. So after the major pandemic, which we can remember during our study time or working time, the infection which we came across was swine flu in 2009. It affected around 6.8 million people. And the death is considered, it's not again an accurate data. In WHO's data shows only 18,000, but it is estimated that around 3 lakh deaths occurred due to H1N1. And the symptoms are again similar. It is again another influenza virus, respiratory virus. So the mode of transmission, the symptoms and the complications are almost just similar to COVID-19, even though it is an influenza. And the important difference between COVID-19 is the mortality in less than 65, that is young people, was more in swine flu. And how this swine flu came to end is because it was less contagious. The contagiousness is estimated by the reproductive number. So compared to COVID-19, the reproductive number of swine flu was a bit less. And the main difference between the COVID-19 and the swine flu is the COVID-19 is having an asymptomatic and pre-symptomatic. That means the patients without symptoms or patients just before the beginning of symptoms can infect a second person. So that complicates COVID-19, and it makes the prevention and control of COVID-19 very, very difficult compared to a swine flu. And the mortality of swine flu, again estimated, is very less compared to COVID-19, but COVID-19 mortality is yet to estimate properly because we are not sure what is going to be the exact mortality in case of a COVID-19. And the last one, the 2002, we had the SARS. The SARS, the important thing is it belongs to the same family. This is the coronavirus family, which formed a major pandemic in 2002. Till that time, the coronavirus was expected to be a very innocent virus, causing only a mild sore throat or a mild running nose or a mild febrile illness. But in 2002, the corona took a very dangerous role by producing this SARS epidemic. And there are a lot of similarities between COVID-19 and SARS. One being a coronavirus, it originated in China. Again, it was a zoonotic which came from bats. The mode of transmission was droplets. But it ended somehow affecting only around 8,000 people. The mortality was very high compared to COVID-19. It came to around 10%. And high mortality and SARS was, again, the SARS was less infectious compared to COVID-19. So we could better isolate patients. We could quarantine them easily because the transmission took place mainly in a symptomatic phase only. And now I have rushed through some important pandemics which occurred in the last century. And now we can summarize the differences between these pandemics and the present COVID-19. And when I summarize these things, naturally, it becomes the challenges in controlling the COVID-19 also. So one of the important thing is the asymptomatic carriers. In all other situations, the infectiousness or the disease spreads from one person to another when the person is symptomatic, whether it is H1N1 or it's cholera or it was a Spanish flu. So it was better or it was easier to control the infection because we could isolate the patient and we could prevent infection from this patient. But in COVID-19, the most important problem is the people who are not symptomatic can carry the virus and can infect the second person. So that makes COVID-19 different from all other pandemics, and it makes control of COVID-19 a very, very difficult process. And the second one, as you all may be aware, the last 2 days, there were a lot of hot discussion happening about the mode of transmission, whether there is an aerosol transmission. If we study the events happening over the last few months, anyone will think of, is it just a droplet transmission or is it just a foamate transmission? There is a very high chance that there is an aerosol transmission also. So again, it makes the prevention of COVID-19 a difficult thing. Then the drugs, the vaccine, etc. are yet to develop in a proper way. And another very challenging question is what is happening to the immunity in a COVID-19 patient? With all our information, with all our knowledge in the virology or microbiology, we were aware that when a person develops an infection with a virus, usually there is a lifelong immunity, but we are not sure that is going to happen in COVID-19 because we are not sure how long this immunity will last and how long the patient will be immune to a second infection. That is yet to be answered. So there are so many differences, there are so many challenges in controlling a COVID-19. So actually the mental health problems, and it should be a stress reliever. So till this time, I am putting forward a lot of challenges, lot of issues, and the organizers might have strategically placed my talk in such a way that I'll increase the stress to the maximum level so that the following speakers can gradually relieve your stress. So I can give some points. The science is not, science has evolved a lot. Lot of research is happening in COVID-19, lot of answers being brought every day. Every day there is something new finding comes in COVID-19. So there are a lot of hopes also. One is the universal masking. Whatever may be the mode of transmission, like aerosol, is it a foamate or anyway, it is through some secretions coming out of the nose or the mouth. So COVID-19 to an extent that is sure. Antivirals, a lot of new drugs are coming. Many antivirals are seen to be effective against COVID-19. So soon we can expect an antiviral which can definitely kill a COVID-19. And the mechanism of the disease, there are a lot of changes, a lot of new insights coming over the last few days or few weeks. That is, one is vascular complication, and the second is cytokine release. That means it's not the virus attacking the lungs alone or the virus attacking the occlusion of small blood vessels. That is a vascular complication. So the management of COVID-19, of severe COVID, is taking a U-turn. Like you have to manage the vascular complications like with using heparin and monitor the complications like investigations like D-dimer. That is a very important turning point in the management of COVID-19. Similarly, cytokine release. It's not the virus attacking alone. There is an immune reaction of the body against the virus that is causing more damage. So there are agents like our age-old dexamethasone or a new one like tocilizumab are being used for severe COVID and with excellent results. And another one is a convalescent plasma we can use from a patient who has recovered from a COVID-19, which can be used for the management of COVID. So from my experience in the last 1 month of June 2020 in Calicut Medical College, we had around 60 patients, all with comorbidities, or we admit only patients with comorbidities or significant or severe symptoms. So among these 67 went into ICU, and all these people are still living. Out of the 7 in ICU, 4 got discharged, 2 are improving in the ICU, and there are no deaths in the last 1 month. So I think that can relieve a little bit of stress or a little bit of tension which is created by myself. You can see the X-ray of one patient who was managed from our center. How bad the lungs is, you can easily know the. And after all these new treatments like steroid, tocilizumab, convalescent plasma, everything, it can clear the a good part of the story, I believe. And this is one photograph of shared by so and the last thing through this history of pandemics during the human evolution before a pandemic.
Thank you, sir. There is no doubt that the current pandemic has made a huge impact on the healthcare system and on health workers and on frontline workers, especially nurses worldwide. We are privileged to have as our next speaker, Dr. Roy K. George, National President of TNA and Director, Academics and Principal of Baby Memorial College of Nursing, Kozhikode. He will dive in depth into the psychological impact of COVID-19 on nurses. I invite you for the presentation. So, Roy sir, please.
Yeah, you will share the slides from that end.
Sir, are you going to share the slides, sir?
I have given the slides to Jayanti. She will share, or I have to share?
It may be better. You may be sharing, sir.
Yeah, I will share. I will share. Okay.
Thank you.
Just enable my video also, please.
Sir, now you can go into slide share mode, sir.
Yeah, yeah. Okay. So good afternoon to all panelists and the colleagues. Also, good morning to the panelists across the globe. Let me first of all salute our brave colleagues who are battling in the battlefields of COVID-19 around the world. For academicians like us, it is easy to sit and speak about COVID or read articles about COVID-19. But those people who are actually in the COVID battle are facing enormous stress, as already indicated by my previous speakers and the person, the madam who inaugurated this session. The amount of stress which goes on in a pandemic is quite unfamiliar to us, because none of us who are alive now has not witnessed a true pandemic. We have studied about pandemic, epidemic, and endemic, and have witnessed epidemics and endemics, but not pandemic. And this pandemic has crossed all barriers of national boundaries and all differences in human race, geographical or climate variations. And it is quite an unprecedented situation where people are quite unfamiliar about the disease, the treatment, even the mode of transmission. And scary reports come in about the number of people get infected. Like in the initial part of the pandemic in India, we were very sure how many health workers got positive and how many recovered and things like that. Well, yesterday we had a meeting with the IMA national president about the number of health workers affected. And the statistics is every day increasing, which causes major stress to people who are actually in the battlefield. As of last Saturday, already 106 doctors have died in India. Whereas the number of nurses who have died are comparably less. Surprisingly, it is only 15 till now, reported cases of death due to COVID. Out of the 106 doctors who died, some of them are not directly in COVID war front, but got infected somehow, and they are also counted because they are also doctors who are working. Something which was found was many of the doctors who were not in COVID centers, who were running private clinics, small hospitals, were infected because they were unaware of COVID exposure at that point of time. Anyway, the number of people who have died is more, and which is itself is a case. And as far as the number of people infected, correct statistics is not revealed, many times, and correct information is not available. This all causes more stress to people who are in the war front. But so what I want to, the topic given to me is psychological impact on COVID on nurses, because as everybody was talking about the stress, whether the stress which is physical, mental, or psychological, or spiritual, it all comes to the great impact on mental health of people who are on the war front as COVID warriors. And as you all know, the current situation is generally of anxiety and panic. Not only nurses, not only health workers, whomever is there live and watching has a certain amount of anxiety. Initially, it was a panic reaction, but now we talk a lot about new normal and living with COVID, etc. But still, the situation is so panic that itself, the anxiety itself, the environmental anxiety which is present in everyone, definitely creates a lot of anxiety on nurses also, especially on nurses who are right there in the COVID care. And the situation is extraordinary and unprecedented. We have read about pandemics when we are studying, or heard about Spanish flu, those who are very keen to history of medicine and history of contagious diseases, but we have never faced such a situation. So the strange situation which we have are not fully equipped to battle definitely creates anxiety. And of course, the disease is potentially dangerous and unfamiliar. As Dr. Shamir indicated, it is not highly fatal, but if you compare to the Nipah outbreak in Calicut 2 years ago, the fatality is very low, but it is potentially dangerous and unfamiliar. That causes a lot of stress on people who are in care. And stress of work environment is very distressing, because initially when the number of cases were less, when there was novelty, there was a lot of support available. Maybe there was some shortage of PPE available, things like that, but still the support was better. But now the stress in work environment is so high because the number of people have gone up. It is getting extended and prolonged. We do not know how many months this will go on. And for those people who are in direct care, it is definitely good. The number of emails and number of messages and number of requests we get at TNA are so enormous that it itself causes almost a stress shock reaction, because we are not able to cope with dealing with those complaints, because the number of messages we get taken up with the government agencies, with the private management authorities, with other people and non-government organizations, it's very difficult. There's a lot of stress in work environment of every nurse who is in COVID. And even in the non-government area, they are under stress because they do not know who is COVID positive, and because there are so many symptomatic cases. And lack of support at work, like Lata Madam indicated, the administrative support is many times less than desirable, or less than what is actually required in this very stressful situation. That is something which actually worries people, because when you are when the soldiers are in the battlefield, if they don't have proper equipments and support from the government and the public, the same situation nurses and other health workers are now in. And because as the situation gets prolonged, it becomes like, though we for the decorative words like new normal, this is not at all normal, and this is, but when this is going to continue, it causes administrative paralysis or administrative weakening in many sections, including government agencies. And of course, less than satisfactory personal protective equipments. Personal protective equipments, a full set of personal protective equipments, for example, those people in Calicut may have seen during the Nipah outbreak, which has happened in Calicut 2 years ago. Otherwise, we were not knowing exactly what the full PPE is and what are things. But what happens now is a lot of people, everybody in and around Delhi and Mumbai is making personal protective equipments, but like N95 mask imported from and the full body gloves, everything, that all are not surely fully standardized, and nurses who are using it are expressing anxiety whether they will protect us, though we are getting it. And many are complaining that initially what they got was of better quality, what comes now they are compelled to wear. So this itself causes a lot of anxiety, and they may have to make life and death decisions later, like what happened in China or Italy is in front of us, where people were forced, doctors and nurses were forced to take ventilator away from patients who are having no hope to save people who are younger or who are likely to. Such decisions may have to be made in a battle situation. Thankfully, in India, we are not up to that, but that also may come. And of course, financial issues. The COVID has the largest impact on the economy of the world. All the countries are affected. And there are financial issues faced by every nation. There are many places in India itself, the payments are delayed in government institutions. And about private managements and private institutions, there are a lot of issues. There are salary cuts, reduced pay or no pay or termination, especially in hospitals where there is they are not non-COVID centers. But these issues also causes worries. And then about those nurses who are in the COVID field, they may have financial issues at family because the spouse may not be able to go for work. The children are at home and their income has taken a dip because of the nurses either in COVID ward or in quarantine, and there is nobody to look after those at home. And other general financial impact affecting the families of all and also nurses who are in COVID duty, and family and social issues, not able to take care of family, not take care of children and the maybe elderly parents or in-laws, such things with a large female population nursing, majority women's profession. They have such issues which may cause us family and social disputes also. And of course, last one, when we are talking on a webinar, it may sound funny, but there is a lot of information overload. Everybody is talking about COVID. Everybody is a master in COVID. Every institution is organizing. Every NGO is organizing. And if you open newspaper, it is only COVID. If you open TV channels, it is COVID. If it is social media, it is also a lot of information over. A lot of misinformation also is coming. And there is a webinar mania, like people are talking a lot of things. And now we want to, generally people how to take a break from COVID also. So thanks to the, at least in Kerala now the gold smuggling has come in, at least COVID has taken little side story. So that is also important. Too much of news and too much of information definitely will weaken anyone who reads it too much. So definitely the information overload and misinformation in social media also has a role in posting stuff. And what it all leads to. Generally, nurses are concerned about their own health. When they are exposed to COVID or even if they are working in non-COVID wards, there is a lot of exposure issues and there is worries. Every human being has worries and anxieties, and there is concerns about one's health. And worries about risk of getting infected. And worries about infecting family members. If I am a nurse, when I am a nurse working in a hospital, I am definitely at risk of getting an infection, and whatever we say about PPE and infection control, the chance may cause anxiety. The anxiety may not be proportional to the risk, but the people differs, personalities differs, the anxiety index may be high, so anxiety. And feeling of being socially isolated. Even if there is no social stigma and isolation, we are, when the person is wearing PPE and is in a COVID ward, they have so much restrictions in normal level, inability to identify people. It is not for 1 or 2 days, it's weeks. When first nurses went on COVID duty, they thought it is for 14 days or 2 weeks or 1 week, but now it is being repeated and we do not know how long it will be. It is an unfamiliar situation where we have no idea or no clue about when it will end. So there are predictions and a lot of information going, but still that is going to cause social isolation, which is the least thing. And accumulated effect of a stressful situation. That is very, very distressing because it is going on and the stress levels are increasing, our bodily mechanism, the usual coping mechanisms are not enough to handle this stress because it is getting extended. And mental fatigue related to PPE use and exposure. Now, donning and doffing of PPE itself is a Herculean task to do it properly. When it becomes everyday practice, and initially we were having 4 hours or 6 hours duty, nurses were asked to have, but now in many places they are hard to have 12 hours duty or more because the number of nurses, many nurses are going on isolation, many persons are quarantined, many nurses are infected, so and the number of patients are increasing. So there are problems with long-term use of PPE and exposure. Then social stigma and violence are being reported initially in many places of the country, but with the stricter norms and the laws enforced by government, it has come down. But still, there are anxieties in nurses about if I get infected, by whether people in my apartment will have problem, how they will look at me. There are issues which may also cause worries. And to sum up, nurses, burnout in nursing is not at all uncommon. It is very common because as the Madam and Lada Madam indicated, we have lot of recognition issues, there is a lot of marginalization. And of course, these three things, the triad of burnout. I didn't use burnout here purposefully because burnout purposefully because burnout has been discussed for years and decades. So this is the problem triad now for the in this season of COVID. It is emotional exhaustion. The nurses get emotionally exhausted due to anxiety and stress of the situation, and depersonalization. The main characteristics of nursing care, the empathy, the compassion, the caring attitude, that will get depleted may get depleted due to long-term stress and long-term exposure to this COVID situation when they are forced to go on working with this non-settling pandemic. And next is decreased sense of accomplishment. When we do a duty, of course, we all do duty for our remuneration and as a job, but there is a sense of accomplishment which we get every day. How much we get because we are overstressed, nurses are overstressed, and the decreased sense of accomplishment. These three things leads to a burnout or a problem triad: emotional exhaustion, depersonalization, and decreased sense of accomplishment. And this is a common burnout picture where nurses who is pulled out for everything from cleaning to invasive procedures, and this situation is much worse in the current scenario. And we are getting reports about these issues in every nook and corner of the country. Of course, Kerala is comparatively better, but still we have a lot of complaints. And what happens? The mental health issues, of course, depression. Varying levels of depression may develop or are developing and are reported from the experts who are working in the field of mental health, those who are working with COVID carers, especially nurses. And suicide ideas are common. Unfortunately, we lost one of the nurses in India, in Gurgaon in Delhi. There was mismanagement of information. She was tested COVID positive. They went to a patient in a general layman. When we inform them that it is COVID positive, there's a protocol form. They are taken time and they are taken to conference and all. But this girl was reportedly informed over the phone by somebody in the laboratory of the hospital, and she was alone in the residence, and she committed suicide. That's one girl who lost. We lost one nurse. We lost, and also she's from Kerala. And there are suicidal ideations reported. There are death wishes reported from people who are going on with stress. And violence and aggression is not very common as far as our part of the world is concerned, but there are reports of violent reactions from nurses, aggressive behaviors, because of course due to stress and mental health problems, and excessive use of alcohol and drugs. It doesn't mean that there is a normal use of alcohol or drugs, but there have been reported cases of increased substance abuse as stress reliever and drugs. And this part is more in the other part of the world, especially in the Western world. Worsening of pre-existing mental health issues. Nurses are not without mental health issues. We are ordinary people with special training to take care of nurses, but there are pre-existing mental health issues which get worsened with this acute and prolonged stress of COVID-19. Deterioration in occupational functioning. As I told in the triad, there is definitely reported cases of deterioration in their ability to function in the occupation, their job, due to stress. And this is definitely affecting their sense of accomplishment and satisfaction in the job. Distress and bizarre behavior reported. Of course, we have reported family and social issues. And this is just a screenshot of what happens, or just a brief account of psychological impact on nurses in this stressful situation, who are especially trying to handle stress, but definitely as a head of the professional association in India, I must say the profession is under stress. Definitely, we who care for them, for the nurses, are also being overstressed because the situation is really whatever symbolic gestures being done to nurses, or doctors to honor them. Those people who are daily on the stress field are continuing to have stress, and it is for the government, for the administration, for the public to support them. And unlike in the Nipah honoring, we deserve a portion of honor when the pandemic is settled. But what we need now is support nurses who are caring for COVID and non-COVID patients in the battlefields of coronavirus. Thank you very much for the opportunity to speak to you all the impact of COVID on nurses.
Thank you, sir. We just heard from the previous speaker how widely the pandemic has affected the nurses in our country. The mental health of nurses has been challenged in the wake of pandemic. What strategies can develop to improve their well-being? So this question will be discussed in depth by the distinguished Director of MHANS, Kozhikode, and Additional Professor of Pediatrics, Dr. Krishna Kumar. Over to you, sir. Sir, please. Dr. Krishna Kumar, sir, please.
Hello.
Yes, sir. Welcome, sir.
Am I audible?
Yes, sir. You are audible.
Good afternoon to all. At the outset, I thank Professor Pannima, faculty of Government Nursing College, Kozhikode, for this opportunity to talk. Hello. I thank Professor Pannima and the faculty of Government Nursing College for this opportunity to talk on the psychological well-being strategies to improve psychological well-being of nurses during COVID-19 epidemic. And the opportunity to talk to more than 500 people, maybe all over India. Most of the things I am going to say is covered by Dr. Roy. Healthcare professionals are the group maximum stressed, even before COVID-19, even normal period also. The stress level is high among nurses, doctors, other paramedical workers. Now, during this COVID-19 infection, unprecedented patient numbers, concerns about PPE, worries about families, as mentioned by Dr. Rai, all these things causes increased stress. Now, WHO says this is not a sprint, it is a marathon. So we have to take long-term measures. It is going to last maybe for more than a year or so. Now, Fernandez et al., they have a systematic review of nurses' experience of working in acute care settings during pandemics, respiratory pandemics in the past. So one important finding not audible. So what they say is during all the past pandemics, where Dr. Shamir was mentioning, nurses consider it as their duty and professional obligation to care for patients. And there was high professional camaraderie and high team spirit appreciation through sharing experiences, willing to work together. There is the past experience. And high resilience among nurses is documented. Now, these are all mentioned already. What causes stress during pandemics? High anxiety for their own health, inadequate safety and protection measures, uncertainty about the effectiveness of PPE, and fear of infection spreading through nursing staff, nursing colleagues, fear of placing family and friends at risk, and ethical or moral dilemma to decide between patients and family responsibilities. And again, there are worry about the social and economic consequence of pandemic. There is a need to prioritize resources. So there is a worry that some patients may not be given proper care because of lack of resources problems. So that may lead to future litigations. And when so many patients coming, we are not able to do anything. There is sense of powerlessness under extreme pressure, and worry that the quality of work may be affected because of community fear and also the increasing demands and unfamiliarity of the pandemic environment. Also, there is in the ward relatives of patients projecting their emotions towards nurses, because usually nurses are the first line defense, and usually they don't have the control over patient flow, leading to physical and psychological exhaustion, death or illness occurring in the colleagues. And this is also, I think Madam during the inaugural speech mentioned this aspect, rapidly changing advice, that our knowledge about the disease is changing almost daily. And most of the time, the information provided is inadequate. And inadequate training in caring for patients affected by the emerging infectious diseases. So these are all experience of nurses from the past pandemics. And of course, there is shortage of staff, difficulty in ensuring adequate mixing of staff skills, appropriate mix of junior staff and senior staff may not be possible, difficulty in adapting to changes quickly, and lack of preparedness and planning at both the management and health department level. So these are the issues which the nursing team faces during epidemic situation, during the past epidemics. Now, based on these epidemics, University of Surrey, University of Southampton has prepared a detailed guideline how to improve the well-being of nurses during the COVID-19 pandemic. This is also in tune with the guidelines issued by World Health Organization recently. When we go through these guidelines, the most important thing which is striking is there is a need for action, effort in the personal level, in a team level, and administrative level to reduce the stress and to improve psychological well-being. And the most important thing which we should remember is psychological well-being is not an isolated thing. It is strongly linked to physical health and also the working environment. So the most important thing is to prepare to have a congenial working environment, and physical health parameters also should be given attention. So coming to the personal level, what we can do to reduce stress and to improve psychological well-being. Pay attention to your needs, safe working conditions, pay attention to food and drinks, avoid physical exhaustion, dehydration, and regular breaks. WHO And all the authorities advise facility or to provide regular breaks to working nurses. Find ways to step away from short, unscheduled break when under strain. And work shorter shift if possible, with enough time for recovery between shifts. It's a flexible working schedule. Phase mnemonic is suggested during this epidemic situations. F means focus on what is in your control. So don't bother about things which are not under your control. So you concentrate or focus on what is in your control. And you acknowledge the thoughts and feelings. There is no need of guilt feeling like or worry, anxiety, sadness, confusion. All these things are normal in this type of situations. So accept these feelings and thoughts. And don't worry about these thoughts. And then come back to your body. You become aware of your body by doing some exercises like pressing fingertips, taking deep breath. And then again, you concentrate on focus on what you are doing. So these type of cycles will help to reduce stress. So focus on what is in your control and don't give consideration to what is not in your control. Acknowledge your thoughts and feelings, then body awareness through some physical exercises or deep breathing. Again, refocus on the activity in hand. During the breaks, relaxation exercises will help to reduce stress. And there are studies that meditation and mindfulness in breaks at work or outside of work may also help reduce stress. Now, the next important level is peer support. So what they say is look after each other. Be aware of your colleagues, aware of their needs, whether they had food, rest, drinks, and talks to colleagues who may need support. And you can relate your experience to colleagues. Staff huddles, small group discussions, and use check-in with each other. Shared breaks also present opportunities. And the whole team should think of appropriate team offload time. Again, be sensitive to people's preferences. Even when we work as a team, some of the team members may not be open to others. They may require their privacy. They may need their own space. So be sensitive to other people's, your colleagues' preferences. And make sure other team members know if someone needs particular support during a shift. And because it is a crisis situation, try to provide that support. A good teamwork, find ways to help new or temporary team members, especially during COVID-19 outbreak. There are a lot of people with not much experience in dealing with infections or pandemics. So try to help the temporary team members or new team members. And combining less experienced team members with more experienced colleagues when the postings are done. And be approachable and authentic. Monitor or check on peer needs regularly. And the newcomers or the new team members, remind them that they are safe here and now. And if there is a problem, the team members brainstorm together and try to find solutions. Recognition of good work done by a team member, positive feedback, respect individuality, self-esteem on evaluation, checking on each other's well-being and support each other during the shift. And when you check the well-being of another team member, check in on someone without annoying them. You can use email or texting, sometimes call on phone call. And at the end of the shift, check in on everyone's well-being. And attendance at this check-in should be optional to you respect individuals' privacy. So that is about the team members. Now coming to managers or supervisors, administrators, they have a big role in reducing the stress of nursing staff and providing a congenial environment. So the supervisor or the manager or administrator, the important thing is be approachable and available. You encourage feedback from the staff. Not only encouraging, you respond to feedback also. Some suggestion from the nursing team. Try if we can find that solution. Anonymous feedback, if needed, may be encouraged. Communicate regularly with staff. Online, if face-to-face contact is not possible. Acknowledge the needs of the staff and show empathy. Value contribution of each staff member and recognize the hard work being done. As Dr. Roy was pointing out, everybody is stressed. So it is very important to appreciate the work done by a team member or staff member. At the same time, be as honest and as open as possible. And you feel that somebody is doing good, you express it and you signal, you indicate that staff well-being is a priority to the administration. And work breaks, WHO suggests it is mandatory for people working with PPE and other difficult situations. Provide comfortable staff break rooms. The existing space may be rearranged for this purpose. Encourage opportunities for team members to meet together and support each other. Hold weekly review meetings to solve problems and address issue depleting well-being. Consciously create opportunities for colleagues to meet remotely or otherwise in facilitated meeting, promoting group interaction. And Dr. Roy was mentioning about several psychological issues like depression, anxiety, suicidal ideation. So arrange for professional psychological support if you feel it is needed. For that, there is a need for early recognition of symptoms. So the administrative organization should have some facility to promote early recognition of symptoms and someone's psychological well-being is deteriorating, and provide a strong, clear message about the value of seeking help at an early stage. Psychological issues, if you identify early and correct it, that is the best thing. Prolonged problems may lead to burnout, psychological exhaustion, suicide ideation and all. And provide information on a range of confidential support options for trauma. So you can have facilities here, this facility can be used, or that facility can be used, this information can be used. So that type of information on and resources for psychological support. And look for systematically monitor psychological health of staff. Look for burnout, which is very common, especially if the pandemic is going to continue for months or years. Then this burnout will be a big problem in not only in nursing staff, but in all other health professionals. And arrange facility for training, especially for new staff. how to deal with the traumatic situations, how to deal with traumatic situations that may encounter during nursing practice, and ensure essential physiological and safety needs of staff are met, address shortcomings when needed, address issues related to PPE, childcare, staff sickness, testing, and other issues of concern to staff. For example, one of the team member may be having a small child, or school-going children. The schools are closed, nobody at home to look after children, or a sick relative. So within the limitations, how these issues can be addressed. At least WHO will advise flexible working time during the pandemic situations, and ensure that staff get managerial support even out of the hours. So if you got a problem, you can call me at any time. So shorter working shifts, flexible schedules, and sufficient recovery time, and time for family contact also. And remove non-urgent business to alleviate staff burden. So concentrate on what is urgent, and rotate nurses from high stress level area to low stress area. Partner inexperienced nurses with more experienced colleagues, making sure that supportive buddy work is shared across the team. Support staff who get sick while away from the workplace and on their return to work. Share successes, no matter how small. I was happy to see Dr. Shamil talking about no death in our COVID care center the last 1 month, and also whatever success, share among the colleagues and appreciate them. Actions that the nurses and the teams can feel pride in, and find ways to show their contribution is valued. So it is very important. If I should feel that I am a valued member of the team, that also the duty, the responsibility of the management staff or supervisor staff. And also the managerial staff or supervisory staff, they also need their own needs and safe spaces. Discuss difficult decisions at senior level so that the responsibility can be shared. Pay attention to staff who may be vulnerable and ensure safety plans are in place for people not to be at risk of self-harm or suicide. As Dr. Roy was mentioning, this is a very important issue. Stress people resorting to deliberate self-harm, suicide attempt, and so pay particular attention to vulnerable people. Plan ahead for long-term support programs for staff recovery. So to conclude, physical as well as psychological well-being of nurses is important for better quality care. But the psychological well-being, strategies to improve psychological well-being cannot be at an individual level. So it needs concerted effort, individual level, the nursing team level, supervisor level, and administrative level. And this message is actually should be imparted to these different levels. How individual level we can help each other, how the nursing, the team, how we can have a healthy team for care of patients. And in the supervisor or administrative level, what all things can be done within the limitations of our resources manpower. And Madam was talking about turn the crisis into an opportunity. So WHO always advised that in every area, we try to turn this crisis to an opportunity. For example, the crisis says give the society an opportunity to recognize the inherent stresses and emotional strain that nurses bear on behalf of society. So even after the pandemic is over, the society will be aware of this inherent stress and emotional strain of healthcare workers and the measures to improve the psychological, physical, and psychological well-being of healthcare workers may be carried over after when the pandemic is over. So thank you for the patient hearing.
Thank you, sir.
Thank you.
Every country around the globe has been affected by the pandemic crisis. Now we shall listen to a few perspectives from COVID-19 from other countries. From Saudi Arabia, we have Dr. Pradeep Prabhakaran Nair, Educational Coordinator, King Faisal Hospital. I welcome you. Hello.
Hello, can you hear me?
Hello.
Hello, sir.
Can you hear me?
Yes, sir. No,
Can you hear me?
you are audible, sir.
Okay. Can you see my slides, please?
Yes, sir. Yes, sir. It's perfect. Can you increase your volume, sir?
Okay, I will try. Hello?
Okay, sir.
The slides are not moving. Is it any? Okay. Can you hear me now? Can you hear me?
Yes, sir. But your sound needs to be
Hello,
raised
can you
a
hear
little
me?
more. Yes, sir. Yes, sir.
Hello, can you hear me?
Yes, sir. You are audible now.
Okay. So, good afternoon. First of all, let me thank Professor Ponnamma for inviting me for this session. And also, I thank all her team members for making this an opportunity for me. And also, it's very nice to see Dr. Roy, Dr. Krishna Kumar, and all other colleagues of mine, my friends actually, they were, Dr. Roy was my senior. Nice to see you also here. Okay. First of all, I just want to speak about my my hospital before I come to the proper what you call steps taken by our hospital. So this is actually, I am actually speaking from King Faisal Hospital, Saudi Arabia, which is one of the prestigious hospitals in Saudi Arabia. In fact, it is one of the prestigious hospitals in the Middle East. And it is actually not a Ministry of Health hospital. It is a general organization, means it is same like our Indian All India Institute, which is like a central government thing. This is a general organization, which has got 3 branches actually. One is in Riyadh, one is in Jeddah, and one is in Medina. So it's a very big organization, and I am actually speaking from Riyadh. And we have nurses from more than 30 different countries working in this hospital. So the question is why these nurses are attracted to this hospital. First of all, why they come from America, England, Australia, Japan, Korea, India, Philippines. Why do they come here? The reason is that the nurses are being respected in this hospital very much. This is a highly prestigious magnet recognized hospital. Magnet, probably the Indian nurses may not know, it is one of the quality standards in America. This is especially only for the nurses. So this is nursing standard. And this is actually the recognition of nurses. So this magnet approved hospital outside America, the numbers are very less. King Faisal Hospital is one of the magnet approved hospital, which means the nurses are highly valued here. Nurses are being highly recognized in this place. And, the nurses always, they are very proud to work in this hospital. So our approach is to develop that culture, develop that culture of, a positive culture for nurses, those who will work very happily in this hospital. So what are the ways we provide comfort and welfare to our nurses here? How do we look after? The hospital provide them excellent salary without tax. That's the reason why people come here. Okay, so a country like Saudi Arabia, otherwise people will not come. But here we provide excellent salary, facilities like a free accommodation, housing allowance and transport allowance. If you want to stay outside, recreational facility is fantastic. We have about more than 23 gyms and swimming pools and tennis courts, and everything is mostly for the nurses. You should see the accommodation which is given to the nurses. Lots of nurses accommodation blocks with lots of recreational facilities. Even inside the hospital, they give a lot of recreational activities like a conducted tour, movie nights, and so many things, so that the nurses who are staying in the accommodation, they don't feel depressed or they don't feel alone. They don't feel that, this is all for looking after their well-being. More freedom inside the campus, though traditionally it's a Islamic country with Islamic law, but inside the campus, nurses, they have more freedom. In the campus, there is no need to wear any hijab or anything. The nurses can be completely free in moving around, and they have activities in place. So there are so many such provisions are there for the nurses' welfare in this place, because the reason is we as a hospital, we are affiliated to organizations like a Magnet, JCI, Sibahi, all these quality, what we call the accreditation companies. Magnet, as I said, it is actually looking at the nurses' welfare and nurses' development, nurses' career development. Nurses, they do independent RN survey. It is called RN survey, independently to understand how the nurses feel, how they are empowered, how they are enriched, how do they feel. So that way the Magnet Hospital status, JCI, our hospital is accredited to JCI Gold Standard. They also look at the standards of nursing. Sipahi is one of the quality standards in Saudi Arabia. And when they come for accreditation, they look at the nurses' practice, nurses' accommodations, nurses' welfare. So in fact, this hospital is actually, it's very, very supportive for the nurses, and the nurses are very well looked after this hospital. And this hospital is actually is having a policy of a high reliability. This is a high reliability organization, and which is aiming for zero harm. So what do the hospital expect from the nurses? What that we have to look. The nurses, the hospital look at the nurses for the best quality service to the patient, service to the hospital, so that the hospital can maintain the HRO, the high reliability and zero harm. So without we looking after the nurses, they may not be able to provide that service for us. So in other side, the nurses who are recruited to this hospital are highly qualified, experienced, and having good attitude. You know, they won't accept people, those who are coming here to just earn money by lazy life. No, if you come here, you should be qualified, experienced, and having a better attitude to work. And because it is yearly recontracting, if you don't perform very well, they will not rehire you. So that's why the nurses come here. We expect them to have certain standard. The expectation is good attitude, commitment, and performance. And in this way, we have a good bunch of nurses actually here. So as a business model, this hospital look for star, superstar, and we say cash cows, that type of nurses. But there is no place for sleeping dogs, in the sense the lazy nurses, those who don't want to do anything, negative attitude. There is no place for that type of nurses in our hospital. So there is a work culture of positive attitude, and work culture of your performance, commitment is very important. So why I have explained to you these things, that first of all, this itself shows that when you work in this hospital, you should have that attitude of commitment and working. So in the previous lecture, Dr. Roy was telling that when the military people go for war, their job is to fight against the enemy. And they have chosen that profession for themselves like that. And when there is a real war, if they don't want to fight, that is their attitude issue. But from the governmental point of view, from the departmental point of view, they should be provided with all equipment. Same with here in the nurses. We are actually fighting with the unknown enemy of COVID, and our nurses, we expect them to be in front line with a positive attitude. And the hospital provide every support, everything, whatever required for our nurses. And they cannot just say that we cannot work because we are afraid of the situation or afraid of our family. We will see that. And from Dr. Krishna Kumar, he has told so many things to be implemented to look after our nurses or to reduce the stress of the nurses. Most of the points which I was listening have been implemented in our hospital. We will see what are these things. So first of all, when we look at the psychological aspect, the problem is anxiety, tension, and fear, which Dr. Roy was telling. Anxiety, tension, and fear. This is the main point which the nurses will be having. So why this anxiety, tension, and fear? They are afraid of their own life. They are afraid whether I will get this infection. It is same like a soldier who is going to the border for fighting. He will be afraid whether he will die or no. He will survive. So the same type of feeling here. So what we have done is we have provided all sort of support to the nurses for them to look after themselves, especially transparency. In Saudi Arabia, you know that just like in India, there is no so many television network or newspaper or anything. But in the hospital, we provide them very good information about what is going on in the world, or what is happening inside Riyadh, what is happening in Saudi Arabia. There is good transparency of the matters, what is happening. There is a counseling hotline available which is anonymous. The nurses can access to that. They can call from any place and free counseling service will be done. If you are suspected, there is free testing available for you. Any number of time you wanted to be tested, you just ring a number, they will arrange an appointment with you and they will do the testing. The nurses need not worry. We take care of the nurses. And if you are worried about your life, what is your exact problem? Why you are worried? That problem will be addressed. And we have a dedicated team for looking after the nurses' concerns. Obviously, the nurses, those who are living with the family in this country, They are afraid about their family members. If I go to the COVID wards and come back to my family, whether my child will be, getting the infection, or whether my husband will be, we give them a COVID yes, a special accommodation. They don't need to go home if they don't want to go. If they are really afraid, we provide them free accommodation. They can be away from their family during this period of time, or we give them some period of rest, to be with their family. And family members, if they are having any exposure or anything, free testing service in the family medicine clinic is available. Even drive-in clinical testing service is available. Quarantine service, quarantine is available. Even the hospital has taken a 99-bedded hotel nearby the hospital for giving giving accommodation, quarantine accommodation for the nurses who are suspected to be exposed. Unknown job role, some of the people, they are really afraid to work in a situation where they really have not been exposed. Don't worry, here actually in our hospital we have conducted cross training for the nurses, those who are working in outpatient department for many years. Since the outpatient department is closed, we train them, upskill them, and allow them to work in the general ward, general area. Then those who are working in the general area, since we have closed down a lot of departments, lot of services, because we made it about 50% service only in the hospital due to COVID, because only essential services. So lots of nurses, those who are free in the general ward area, we did the cross training for more than 500 nurses. And we have expanded our ICU beds, and these nurses were called to work in that critical care and HDU type of facilities after giving them training. And as Dr. Krishna Kumar was saying, we are practicing team nursing, so that we mix highly experienced, skilled nurses in ICU with less experienced people. So you don't need to worry. There are people always for you to support and give you training and give you a hand whenever is required. Next point is, so here actually we are actually looking at the 4 E's, the education, that is cross training, empowerment, enriching, engaging them. So the nurses are actually very well taken care here. Lack of information about what is happening. As I said, the CEO of the hospital, he is actually from the royal family, and he is actually doing a what you call webcasting every day morning about about the statistics of the COVID, what the hospital is doing, and there will be lots of questions which he will be answering. Anybody can send a question to him, he will answer, and also all the concerns he is actually directly accepting all your concerns. So any nurse or any employee in any level can send a message to CEO, he will answer. Then the MOH, Ministry of Health in Saudi Arabia, they have Twitter service, which is coming in our mobile phones with all the information, what is happening. So we can easily get information from Ministry of Health. CDC, Saudi, that is Center for Disease Control. They are updating their website all the time, and they are sending us message as well. So we know actually what is happening in Saudi Arabia. Then hospital website. If you look at the website, you can even log into the hospital website. Lots of information is there in the hospital website. Whatever is your concern, you just go into the website, you will see everything, even all the CEOs webcast, department heads webcast, everything is recorded there. You can go back at your free time and you can go through it. So you don't need to worry, you will know all the information. If you don't know something, you can always contact your manager. Job assurance with a full salary. There are some people, those are afraid of losing their job if they are, if they get sick or if they cannot come for a job or something like that. No, full job assurance is given. Even there are many nurses stuck outside the country. They could not come back to the country because of the flight unavailability. all these people in different countries, they're stuck in different country, they are all paid, though they are not working. Full payment is given. Those who are quarantined, or those who are actually in the hospital working, full money has been given. So there is no financial insecurity or anything. And transportation, if you are coming from outside, from the Ministry of Interior, the letter has been given to the nurses so that they can travel to the hospital and back to their house without any problem during the lockdown period. So to conclude from my side, actually, this hospital is looking after the nurses very well. And what Dr. Krishna Kumar has explained, the measures to be taken, I think I was just listening each point. We have actually taken lots of measures to help the nurses psychologically. And to be honest, mind is in our control. Our mind, we are the masters of our mind. The hospital, the country is doing a lot of things. Even the king of this country has declared that every COVID patient in this country will be treated free of cost. So when they do all these type of thing, they only expect us to work properly for the hospital with a positive attitude. And still, if you cannot work, if you cannot commit yourself to the service of the patients for which you have taken the decision to become a nurse, that means you have to correct yourself. You have to change your attitude. That's the only thing in this country. If you are not willing to change yourself, if you don't have a positive attitude, that means they will not recontract you. You are not for this hospital. So that's the thing. So, but I think the hospital is doing whatever they can for helping the nurses, and money is not a problem in this country at all. They have lots of supply, PPE, everyone is being supplied with a mask, and whatever you want, they're providing. So money is not a problem at all. And support wise also, there is no problem at all. The nurses are well looked after. Thank you very much.
Thank you, Dr. Pradeep. From Australia, Mr. Rupila Anandan, School of Health, Federation University from Australia. Over to you.
Hello, good afternoon. I think I can't open my video here. I think they says that someone from that side closed that video. The host has, yeah, okay, I am starting now. Okay, good. Hello. Hello,
Yes, sir,
can
you
you
are good.
hear me? I think I am operating my slide from this side, okay?
Yes, sir, it's okay.
I think, would you able to, yeah, okay, great, thanks. Hello, good afternoon, everyone. First of all, I just want to thank Professor Pandama ma'am for inviting me for this webinar. And also I'm really excited. I am presenting or sharing my experience from Australia, especially I think around more than 500 participants. First of all, actually, Pradeep sir, so he is my senior actually. I think actually he was really giving a good information about your hospital that I really want to maybe I quit my job here, maybe I come over there if that's okay. But anyway, and also a respected or distinguished guest. So today, actually, I'm going to talk uh, about my views. Actually, basically, I'm mental health nurse. Um, actually, I'm a nurse actually with over 23 years experience, but the last 15 years I was working as a mental health nurse predominantly. The last 10 years I was in Australia. But actually, I don't have, there is no direct involvement with the front line, the with the front line as a I was not working as a frontline worker. So basically, the reason for this presentation is I just want to share my concerns, what were my emotions, and how did the pandemic, the issues they affected on my mental health. As you see, I think basically, that like you, the other people, I also felt like this is the different new monster. It's for me, it's a monster. And also every day we used to watch some videos and news around all the globe, and the cases were increasing. And also, and I felt like this is a monster shark as well. And also we know that we are living far away from our home country, and even to be honest, this really impacted our family life, even my mental health, and also it affected my work as well. So I currently doing my full-time PhD. So due to that commitment, actually I am working as a casual staff. What's a casual staff means? I'm a temporary worker. So what we do, we just I work probably a couple of hours. Maybe when I am free, I get to go to work and get. Uh, by doing the casual worker, I usually get some money to pay off my mortgages. But at this is the last 3 months, actually, I don't have any work. That is significantly affected my mental health. So what I say, not only those things, the impact of panic buying, that you might have heard from the news articles that the panic buying, not only I don't know about in India, but in Australia, it was a big issue actually. And there was a shortage of rice, egg, and pasta. And also, moreover, there was a big fight for the toilet rolls as well. You know that as an Australian citizen of Indian origin, we are never concerned about the toilet rolls. But since I have been here for a long time, it is actually become a part of our life. So actually, it becomes an essential item for us. So those kind of news, and as well, the impact of social medias and news. That's not only India or around the world. Here also the nurses were assaulted, the doctors were assaulted, and also the nurses were abused in the public. So that this all kind of this all information, definitely it's affected. To be honest, I felt like that, whether it is angry, sad, or I was frustrated or exhausted, or so I went through different kind of emotions. So why I'm saying this to you, because we know that even at the times of hard times, we always work in the front line, and also we, um, at the more difficult times, we usually working, and also especially when we had a bad day at work, usually, we try to cope, but sometimes it may become out of control. And also, we know that the COVID-19 crisis may be a challenging, and we find ourselves feeling overwhelmed as well. To be honest, as a nurses or doctors or any, we are not immune from a harmful stress response. So from my point of view, I think it's a choice is ours, whether to accept or not to accept the stresses. So we have several choices. So I think I just want to play an experience of one of my colleagues. He worked as a general nurse in here. So I don't want to repeat what I think the eminent speakers already told about how do we, what are the coping strategies. But from my perspective, from my point of view, what we used to do here, so even if I am under stress, just a simple question we'll ask, are you okay? Even if you ask your colleagues, it doesn't matter where you work, even if you are in a COVID frontline area, even into the colleagues, even the other eminent speakers said, like the involvement individual level, supervisory level, management level, and even the simple manager, they can ask, are you okay? And also, I think I believe it is the honest. We need the honest response from the nurses. We don't have to hide anything. If you are anxious, if you are stressed, you should say. You should be honest. You should open your mind. And also, I believe that we don't lose hope. And also, the same thing the other speakers said, switch off the all non-essential social medias, and also connecting with the other networks like family and friends. And also, so for me, actually, what I did, especially when we are when we were under lockdown, especially we don't do celebrate. We used to celebrate the birthdays at home, but this lockdown didn't stop us to stop the celebration. So what we did, even if because as I told you, this due to the COVID lockdown, I lost my job. It impacted financially, and also doesn't stop me to celebrate, because even we don't have a big cake. So even if you buy a small piece of cake, that is more than enough. So that's what I mean. I think even at the workplace, even if you, the supervisors or managers, if you share a small piece of cake, that is more than enough, at least to make the staff happy. And I think I believe that it is the staff there, not only you guys, but I think we need a support, and we should be united as well. And the important things, as the other speaker, they told that about attitude, empathy, and self-efficacy. Of course, it is an important factor that also you need to be considered. And here, as an expert, please, this is a views from an expert. I'm just playing the video now.
It's not audible.
No sound for the audio. No video. Video is not. Video is playing. No sound.
I like what he has said. Dr. Michael has said, just without having a healthy nurse, we don't have a healthy patient. So what I used to do in coping, finally I'm learning or accepting and learning to live with this crisis. and especially from the family side, that we probably as nurses or healthcare professionals, we know about how to prevent, we learned about infection control measures and things. But the other lay people, the other people, like, maybe our family members or the police, they don't know. Even my family, my wife also, she's very anxious. She asked me, oh, many of us could die, which is going to become pandemic. So so they are very anxious. I think the answer, they asking, the world is changing. Oh, we should tell them, so it is always changing. It's like impending fear. I think everyone has got, even me also has got still that's kind of thought, but still I'm accepting. And I think that's the only thing from my perspective, I would say. Once you accept, then I think the 50% of the problems are solved. That's then in summary, what I say, I have learned a mindfulness as part of my PhD study. So whenever I want to stress, I usually practice mindfulness. As Dr. Krishnama was saying that, he's saying that the mindfulness will help to ease or release the tension or anxiety. So I think probably from my perspective, probably the nurses at workplace, even if they take at least 2 minutes, even if if they, when they wash their hands, at least if they concentrate, especially if they pay attention to the present moment with openness, curiosity, and without any judgment, no matter what's going your life right now, no matter how many thoughts racing around your mind, no matter how the body is feeling, just take a moment, sit down and practice mindfulness. So here I just had got a 2 minutes video. So I don't know if is they going to ask you to do a small mindfulness. So probably I think it is helpful if, with your permission, I'm busy playing. So probably just to follow the instructions from the video, what they're saying, please.
Thank you, Mr. Ruler. Thank you very much. Physical
Hello.
and mental health are both sides of a same coin. Both are interrelated and interdependent. How can nurses prepare themselves to improve
Hello.
their well-being? Hello.
Can you hear me? I didn't finish.
Sorry, sir.
You can continue.
Sir.
No, that's okay. That's okay. So actually, basically, I was paying a 2 minutes mindfulness, but that's okay. So I'll just go to the next slide. So anyway, I think those who are interested, maybe they can, just get the slide later. So what I was saying, if
Sir, you can put that video in the video link in the chat box, sir. Because your videos, audios are not playing well. It's not audible to the attendees.
okay, that's okay then. So I'll put a link there. Definitely, I'll put the link there, and also just I'm going to the next slide. Yeah, so as I said, as Dr. Michael said, see, healthy nurses means healthy patients. So remember, I think as I said, the self-efficacy is very important. And even Dr. Pradeep was saying, the experienced staff. He was mentioning about the experience. Of course, I think when the nurses are working with an experienced staff, the mastery of the experience, if they got a more experience, maybe they can help the junior staff. And also the vicarious experience, like a role modeling. If we, if you the frontline nurses, say for example, if you are acting as a good role model, so that also maybe the junior staff will see they are good, doing a good job. Maybe in that way they can follow. And also the verbal persuasion, that's an important thing from my perspective. So constructive criticism is important, not the negative criticism. And also, we know that we are talking about the psychological distress and anxiety and everything, but the psychological, that when we are under stress and anxiety, so our self-efficacy or self-confidence decreases. So I think moreover, so that's why we need to look into the anxiety, and especially, and in here, say for example, I think it may be the good idea to give a protected time. It's like, you know, you need to give some protected time to each staff, like protect break, probably a 5 or 10 minutes break. That would be a good idea. That's my, so this is my experience from Australia, and thank you very much.
Thank you, Mr. Rubla.
You're welcome.
Physical and mental health are both sides of the same coin. Both are interrelated and interdependent. How can nurses prepare themselves to improve their well-being? It's a question that Mr. Anish Kumar, Nodal Officer, COVID-19, Prevention and Control, and Assistant Professor, Government College of Nursing, Kozhikode. He has undergone a certificate course on disaster preparedness at National Institute of Disaster Management, New Delhi. He will speak on system readiness and psychological well-being of nurses. I welcome Anish.
Good afternoon to all. Many studies indicate that nurses experiencing high to moderate levels of burnouts and high levels of fear while facing COVID-19 pandemic. Most of the nurses experiencing high levels of anxiety, depressions, and emotional exhaustions also. Reasons for these psychological problems are many. It includes social and family support, self-efficacy, resilience, and the system readiness. In the next 10 minutes, I would like to highlight how the system readiness or hospital preparedness can contribute to the psychological well-being of the nurses. For this presentation, I have incorporated the knowledge base from National Institute of Disaster Management, Government of India, World Health Organization, and CDC USA. Let us place this COVID-19 pandemic into a disaster cycle. So immediately after this biological disaster strikes, we are responding to that biological disaster and we are starting the relief operations. And following that, we are focusing on the rehabilitations. And in the late part, we are focusing on the prevention and mitigations. Most often, we are forgetting about the preparedness for the system readiness. When the system is ready to face the pandemic, we can reduce the disaster response as well as the psychological issues faced by the frontline workers. Impact of a biological disaster is equal to the sum total of biological hazard plus system vulnerability. That is, we are now facing the biological disaster as the COVID-19 pandemic. We cannot do much with the biological hazard because it will happen at any time. It can happen in the coming years also. So what we can do is, we can correct the system vulnerability. How we can correct the system vulnerability? We can improve the system capacity. So when our system is ready, that is, system capacity means it is nothing but the system readiness. When the system is prepared, naturally it will reduce the impact of the disasters and the psychological problems among the frontline workers. According to WHO, the system readiness is supported on 6 capacity building blocks, to include the service delivery, health workforce, informations, medical products, vaccines and technologies, health financing, and leadership and governance. The 6 capacity building blocks include the good health services. Good health services which deliver effective, safe, quality personal and non-personal health intervention to those that need them when and where needed, and with minimum waste of resources. The next pillar is the well-performing health workforce. So health workforce that works in ways that are responsive, fair and efficient to achieve the best health outcomes possible in the given available resources and circumstances, sufficient staff, fairly distributes, and they should be trained periodically to face the pandemic, and must be competent and responsive and productive. Next pillar is well-functioning health information system. It ensures the production, analysis, dissemination, and use of reliable, timely information on health determinants, health system performance, and health status. One of the best functioning health information system I can point to is the dashboard of Directorate of Health Services of Kerala. It is open to the public also. It is an interactive dashboard which gives daily report on COVID-19 statistics, test results, hotspots, resources, psychosocial support systems, public information, hospitalization, home isolation, etc. So the information is open to all and can access to anybody. Based on that, we can get ready. We can ready the system, or we can improve the capacity of our system, or we can identify the shortfalls and we can act quickly to correct that shortfalls. The next pillar is medical products, vaccines, and technologies. And these products must be with assured quality, and it should ensure safety, efficiency, and it should be cost effectiveness, and it should be scientifically sound. The system must be ready with the sufficient supplies and instruments to face the pandemic. Good health financing is another pillar in the health system readiness. It should raise adequate funds for health, ensuring people to use needed services, protected from financial catastrophe, provides incentives for providers, and efficiency for the last pillar for system readiness is the leadership and governance. So a leadership and governance should make the strategic policy framework or SOPs with effective oversight, coalition building. There should be a space for coalition building. There should be provision for enforcing the laws and regulations, attention to system design, and in order to identify your system risk or your system readiness, that is, WHO has pointed the 6 pillars. So in which pillar you have that deficient portion exist. So you have to identify that system risk. Otherwise, the risk will increase the impact of disasters. So this risk we can identify by using this triangular model. So H means the biological hazard, E means the exposure to hazard, what is the chance of getting these types of biological hazard, how much we are prone to get these types of exposure, and V means vulnerability. If such an exposure occurred, how much we are vulnerable? What is our capacity? So risk means nothing but the expected loss due to a hazard. So based on this model, we can identify our system readiness or our system vulnerability. So as far as we can reduce this vulnerability by analyzing this risk model, we can reduce the impact of a biological disaster. In order to reduce the vulnerability, we have to increase the capacity or the system readiness. So identify your system readiness. So system must undergo a HRVC analysis. That is, the system must undergo hazard, risk, vulnerability, and capacity analysis to identify what are all the incapacities in your system. That is, each hospital or each health system must develop a comprehensive hospital readiness checklist. So this is a link given by CDC USA to prepare a hospital readiness checklist. So I will share this link in the chat box later. So every hospital must develop a hospital readiness checklist. The essential components of a hospital readiness checklist must include structure for planning and decision making. That is an SOP, that is development of a written COVID-19 plan, facility for communications, consumables, durables, medical equipment and supplies, identification and management of ill patients, visitor access and movement within the facility, occupational health, education and training, healthcare service and surge capacity. So these are all the essential components of a hospital readiness to face a pandemic. So every hospital must prepare a hospital readiness checklist based on this model. On psychological perspectives for nurses, or to reduce the psychological problems of the nurses, we have to plan the following points, or to include in the SOPs or in the readiness system readiness plan. So it includes keeping all staff protected from stress and strain, ensure good quality communications with the staff, provide psychological and psychosocial support facilities for the staff, orient the staff to the quarantine facilities, provision for managing urgent mental health and neurological compliance, ensure availability of essential psychotropic medications. So when the system is ready, the system must undergo as per the protocol or SOP developed when a pandemic disaster strikes. So final result is reduced psychological stress and improved psychological well-being of all workers while facing the pandemics. These are all the references and links. First one is the National Institute of Disaster Management by Government of India. You will get all the links for system readiness or hospital readiness, how to make a hospital ready to face a disaster. Next is the WHO link, which will give the strategical operations to face the pandemics. And CDC USA website will give you the checklist and various psychological problems analysis is being published in the Lancet. Thank you, organizers, for giving me a chance to present in this esteemed platform. Thank you.
Yes. If the system is ready, naturally the psychological burden will also be reduced. Thank you, Anish. A second wave of the infection is in the news. How safe are we moving on? What are the guidelines for further practice? Dr. Reena George, Head of Department of Psychiatric Nursing, Enhance Code, will speak on how nurses are to move on in their practice with COVID-19. I invite you, Reena.
A warm good evening to all. At the very outset, let me congratulate the organizing team for rightly perceiving the topic and selecting the resource person and giving me an opportunity to share some thoughts with you all. So moving with COVID-19, when we discuss, we know that it's a reality. Some things we can control and some things are we cannot control. So when we consider COVID-19, why Maslow's hierarchy of need matters, COVID-19 has shaken all the aspects of our daily life, starting from the physiological needs like food, water, warmth, rest, and safety and security is shaken that most of the people are afraid of this, and belongingness, that we are maintaining social distance, esteem needs are affected, thinking the economic erosions and self-actualization. All these features, all these areas are affected by COVID-19. So we can say that a normal human being's life is shaken by this pandemic. So the challenges a country with COVID is facing, already all the experts have spoken that asymptomatic cases are one of the challenges. We don't know who is spreading and who is the carrier of this illness. Absence of readily available medicines and vaccines, changes in academic culture, that restricted classroom structure to we are moving to the more internet online structure. So price hike for amenities of basic needs, public transportation issues, migrant workers and daily wages have to find new source of income, protection of children, crashes are closed. So working parents have to find another resource for keeping their children. Health of senior citizens. Most of the senior citizens who have crossed 65 are, they feel they are healthy and they don't stay at home. They feel reluctant to stay home. So once individual's health care were a self business, like I take care of my health. Who are me to ask? Who are you to ask me? That was the concern once. Now it's moved from a self to public responsibility, and Ministry of Health and Family Welfare has clearly instructed the public, if a suspected or confirmed patient is found in a public place like a mall, contact helpline or nearest medical facility, and a team of doctors will arrive to assess the risk, and the management of cases and the contacts will be managed, and at last the disinfection of the whole premises will be done. So it's moved from self to public responsibility is the current status. And post-COVID culture, when we think about post-COVID culture, what will be the next? Mask and sanitizing hands, social distancing will be a usual way of dressing. Like then work from home. Work from home is encouraged by government to prevent maximum contacts, and temperature screenings at every entry will be mandated, and restrictions of entry of people with even slight fever or allergy will be prevented. So human beings are back to indoors. They may be reluctant to come out, thinking of all these restrictions. So we have to learn with this virus, learn to live with this virus. Changing consumer behavior. Okay, so rethink needs are luxury or necessity. When we take care of our patients, we should know how they have changed. Know your client before treating or caring them. So their behavior might have changed from is it a need, luxury or necessity? For example, if we are preferring them to stay in a suite room of a hospital, they may tell, we need a minimum charged room. So we don't have money to save because of the economic erosion and uncertainty in the future income. People may be moving from and analyzing their needs are luxury or necessity. So being healthcare professionals, we should understand our client before giving care. Spending for health and social security safeguards are becoming more popular. So people are more worried about their health and they may go for health insurance and social security safeguards which provide them security. So restricting movements also one of the practices doing by your clients. So what you have to do is if a client is coming to hospital, their needs like medicines, insulin syringes have to be prescribed not only for a week or a month. It has to be prescribed for more than 1 month, so they can restrict their movements to come out to purchase these things. And less physical, more digital becoming more popular. Like people are opting less physical and more digital. So our all health educations and our prescriptions, our care, how much ever it is possible, have to move through more digital. Like if we prepare a health education material, it should be reaching all the people. So it has to be moved from a printed form to the digital form. And self-conceit driven consumption, people are more focused on the self-care and they like to pamper themselves. So they will give importance for their care, health care. So we have to give importance for the patients and bystanders, that at least the social distancing has to be provided for the people, that adequate distance should be kept in the waiting area. And we have to provide all the materials like a hand sanitizer. And if particular people are taking care, like a face shield has to be provided for them, especially when we are doing speech therapy. Like, so stronger risk aversion is there in the people. If people are finding somebody who are on quarantine or who are in contact with the people in quarantine, they will surely inform the helpline or others. So risk aversion is so much in the people. And uncertainty and income erosion is another thing. Uncertainty about future income, whether I'll get salary next month, or income erosion is making people shaken. And they, once the people were longing for the brand items, may come down to the items which are commonly available. Like for example, recently we have read an article in the newspaper that people are going more for generic medicines than brand medicines. Generic medicines are more cheaper and brand medicines are more expensive. But one thing is that it's not much available in the pharmacy, since the profit for the pharmacy people are less. That's why it's not available much like brand medicines. So we have to think when giving prescription, our patients have to be getting adequate treatment, adequate facility, and they should not stop their medicines on the way. So have to, when you are interacting with your patients, you can tell your doctor prescribe generic medicines if possible, so that all the people will get chance to continue their medications. And you know that whenever any crisis arises at a home or any places, the women will become key decision makers. They have immense capacity to see or control the amenities necessary at home, or how to come down to the lowest level. Only basic needs are met. So give some chance for women to think and take decisions. So they will be helping us to continue the treatment for patients. Or if, for example, if any hospital is facing crisis, if the women given chance to speak, they will think what are the essentials and how to prevent the hospital status going down. So rent it or lease it is another popularity by your clients sometimes, because if a patient is needed an oxygen cylinder, when they had money, they used to buy it. Now they will go for rent it or lease it because of the uncertainty in the income. So understand your patient. Whenever you prefer them to buy something, if possibility is there, tell them to rent it or lease it than buying it. And preference for larger unit size for daily essentials. If you know your patients only, you can give them care. Like whenever they come to the hospital, tell them to buy larger unit size to avoid frequent hospital visits. Like as I have already mentioned, if one person is a diabetic and taking insulin every day, he has to purchase insulin syringe for big packets, so that he can prevent coming out and giving and being in contact with the people during the coming out. And coming to the nursing, living with COVID-19 challenges in nursing, We know that since nurses are the frontline warriors in COVID, they are facing a lot of challenges. Like whatever is there, you should think that we were thinking once patients as the center of attention. But now in the case of disaster paradigm is just changing. It's like upside down. Self and team are important here. If you are there, only you can take care of your patient. So you take care of yourself, use PPE or whatever the protective mechanisms as per your hospital policy. And next priority is uninjured or unaffected public. So health education is most important, or whoever is coming out during quarantine, you should notice them and tell them to be at home. And next is casualties or affected patients. And last is the environment. Remove the hazard from the environment is another paradigm. Action steps to mitigate a dangerous or threatening situations starts from the self and the team. So priority you have to give for yourself and your team. And you know that personal protective equipment, the kit include all these things. Shall start? Am I audible? Okay. Sorry for the interruption due to some technical error. We couldn't. Sorry for the interruption due to some technical error. We couldn't show the previous slide. So starting from here, this is the protection triad. You might have seen a slide in Dr. Roy K. George's presentation, during presentation, that a problem slide. This is it's continuation of that, like it's a protection triad. So contaminants are everywhere. So when we move through the bedside, we can get contaminated, or we can even we can infect our PP. So limiting contamination is our ultimate job. So when coming to the patient side, if it is necessary, only you can touch the patient and touch the amenities used by patient, and wear protective garments. That is another good practice. And good technique is avoid contamination of your PPE. So after wearing PPE, we may get overconfident that we can touch anywhere, we can do anything we want because we are wearing PPE. So better good technique is avoid contamination of your PPE as much as possible. And avoidance is avoid contamination of avoid transference of contaminants from the one patient to another patient, or from us to patient, or from the patient to another patient. And this is hazard hierarchy of control. It's a 5-tier process. So when this is given by National Institute of Occupational Safety and Health, NIOSH. And here, when you see the triangle, you can say it's a bottom-up approach. So PP is the least protective things in this scenario. So just see, start from elimination. Elimination means physically removing the hazard. The administrative people have to do maximum to protect the health of the employee, like physically, if possible, physically remove the hazard, eliminate, like giving people a chance going to the quarantine, and after duty, giving them accommodation to stay other than going home. They can stay away till they get a negative. So substitution is replacing the hazard. Sometimes harmful hazard is less expensive than harmless hazard. Like I tell you that if you have to wear a N95 mask, it is expensive when compared to surgical mask. But the protection N95 is giving is different from the surgical mask. So authority has to replace the harmless one. Like though sometimes we may think about the cost, but long-term saving, like when we consider substitution, will help us in controlling the hazard. So next is engineering, isolate people from hazard. As much as possible, we can isolate people from hazard. Like now government is doing reverse quarantine is one of the way to isolate people from the hazard. Another thing is administrative control, change the way people work. Now also it's practiced in Kerala, government sector and other private areas, like all the people are not coming to office, and work from home is encouraged nowadays. So it's a type of administrative control. And of course, PPE, personal protective equipment, is given for the people who are directly involved in the care of patient. So when thinking about this hierarchy of control, not only wearing PPE will help you, but if all other things are doing, then only this will be effective. So this is considered in the hierarchy of hazard control. PPE is considered as the least protective thing. So starting from the elimination till PPE, if we follow, then only we can say that our nurses or our healthcare providers are safe. This is from National Institute of Occupational Safety and Health. And when thinking about nursing, how to move, nursing needs vigorous continuing education. As our pioneer Florence Nightingale has told, let us never consider ourselves finished nurses. We must be learning all our lives. Recently, you came to know that Government College of Nursing was involved in the teamwork of educating doctors and other healthcare professionals from various other specialties for intubation, airway, all this emergency management. So it's a necessity of the need of the hour, we can say that, because we cannot escape from a particular job saying that we are not trained in that. If we are healthcare professionals, we have to take up some responsibility. So it's vigorous continuing education is necessary in all the spheres of healthcare. So if we are lacking in particular area, the institution has to do in continuing education and take care of your staff, that so that they can protect themselves and others. And another is, you're important in managing a health crisis. The nurse or healthcare professional should know you are important in managing a crisis. Sometimes you have to play multiple roles. You may have to address the healthcare need, the mental health care needs of your client. So you feel that you are important. That feeling itself will give you a power to move on. And if you are some experts were telling that nurses have low self-esteem and they move back. You have to come front. Nobody will hold your hand and put you in front and say that you lead. Never. You have to take a chance and you have to take the opportunity to come forward, and wherever you have chance to help in the crisis, you can take up the roles. And so you may have to play multiple roles and bring the healthcare professionals on the track to universal precautions. I worked in one of the medical college of Bangalore as staff nurse for 3 years. During that time, I have observed my colleagues, my co-workers were not using gloves when drawing blood of the patients. Once I asked, they told me, we are not comfortable and we are not able to palpate the vein of the patient when wearing gloves. So that shows that we are not practiced. So from the student period itself, we have to teach our students, and we have to learn ourselves wearing personal protective equipments, or at least gloves when drawing blood or that type of procedure. So when we are practicing on it, it will become a habit. It has to become a habit. Here, the nurses or healthcare professionals' role is not only wearing or protecting themselves. You have to bring others on the track to use universal precautions. You have to point them and tell, you have to wear this because you have to protect yourself. It's not only you will be spreading infection to others. And train the nurses to be assertive and confident in their abilities. The nurses learn a lot of things from the first year till their final year of course. And after that, daily they are learning, but they are not assertive. Assertiveness is addressing your rights without harming the rights of others. So when nurses become assertive, naturally all the respects, everything will come to you. So be confident in your abilities, but you should be able to apply what you are learning. So that courage should be there to apply. So that you have to involve in various research activities, read a lot of research, then only you can say that. So you're in the fear, you cannot do anything. And come to the forefront. You are in an important healthcare team. Come to the forefront and take the credit of that. You should be able to tell that I have taken care of this patient and patient survived. So I am one of the members in the team. You should be able to tell. But usually what happens, you will go back and you will stand back hiding behind some other healthcare professionals. So what will happen? Nobody will recognize you. Nobody will give you a chance to come front. So you come forefront and tell, I cared this patient during COVID-19. Unfortunately, the patient has not survived. Till you have cared them and you have provided all your flesh and blood to take care of the patients. So take credit of your work also. Respect yourself, love yourself. And if somebody asks you, why did you become a nurse? You tell, I love nursing. I love my profession. Then only others will respect you. Unfortunately, some of you may tell, I have been like this, what to do? I have not selected. Happen. Never tell like that. It's your bread. You have to respect your profession. And you say that I love nursing. And more focus on disease prevention, health promotion. We have to care more that patients, if patients in the future, if patients are there in the ward, I'm not telling about COVID-19 patients, other patients, if they are ambulatory, tell them to frequently wash their hands and bodies frequently. So we don't know who is the carrier of what type of infection. So if they're ambulatory, restrictions of movements are not there, tell them to wash their hands and bodies frequently and wear a mask in the presence of visitors who are coming to the hospital and stay in rooms. Tell patients to stay in rooms, don't walk here and there, and use of PP, changing food habits of nurses have to be changed. Your nutrition have to improve. We have taught, we were teaching that if a patient have no patience to take food, we may prefer the patient to take finger food. Same way, the nurses have to take food which they can take easily on duty, like nutrition-rich, protein-rich food. And water breaks, nurses have to take water breaks. Most of the time, nurses bring food and give it back home. You take it back home because they think they don't have time. If you want time, it should be taken by you. Nobody else will take. And this time you have to take water break. This time you have to take tea. Nobody will tell you. It's your decision. You finish your work in orderly, organized work, and you will get time. Never miss your breakfast. That is another issue. Most of the healthcare professionals are affected by COVID-19 when treating patients. If you have immunity only, you will be protected from illness. So never skip your breakfast or your food. Make exercise a habit. If possible, you do it. Somebody asked me once, we are running around in and around the world. Do we need exercise? And exercise should be pleasurable. When we are running, we are in the stress, taking care of patients, saving patients' life. That's not considered as exercise. So if you want to do exercise, it should be pleasurable. At least move sometimes in your rooms. Setting priorities, reduce the exposure to the virus has to be considered in future. Reduce exposure means already I have told you, you wear personal protective equipments and at least a mask when interacting with the people, visitors of patients. Protect patients and themselves from infection. Manage mental stress. Mental stress is one of the factors which bring down patient nurses or healthcare professionals' immunity. So nurses have a habit of reading newspaper. I don't think they have a habit of reading newspaper. Some of them will be reading, majority may not get the time. So at least read newspaper to know what is the condition of the pandemics or any outbreak of new epidemic is there in particular area. Check the WHO internet website, Ministry of Health often to keep current guidelines. So maintain the updating of your knowledge, especially in relation to the epidemic and pandemic. And we were learning to do high-tech, high-touch approach. So this is the hour to think about high-touch, necessary touch. When you're going to the patient, club procedures to minimize frequent visit. If possible, club procedures to minimize the patient's visit. Like you are cleaning the patient and you have to do suction of the patient and you have to position the patient. If possible, club all these procedures so the patient also will be comfortable that you are not visiting them and disturbing them frequently. And talk when necessary. Don't do unnecessary talk with the patients. If necessary and patients also wish, then do. We have heard during even talk also can transfer viruses. I am not making you afraid of this situation, but if necessary only talk. Strict hand hygiene, sit away from the patient, but make sure that you can see your patient. Some people will have the habit of sitting close to the patient, even there is no necessity. If needed, you sit near the patient, but if possible, you sit away from your patient so that the contamination will be minimized. But make sure that you are seeing your patient and you are reaching based on their cues to the need. And from high-touch approach to high-tech necessary touch, when we think, we can use communication board. Most of the hospital, this is taken from a hospital abroad that July 3rd, 2020, they published, they are using communication board to teach, to care patients with COVID-19. So this is based on your choice. Like these slides are showing anxious, awful, confused. So patient can, if it is kept at the patient's bedside, patient can touch and show if he is anxious because patient may have mask like respirator. Whatever patient speak, you will not understand. So you are going close to the patient, keeping your ear near the patient's mouth. It's not that healthy in this situation. So better to use communication board. In that communication board, what all things have to be included? It has to be met patient's need. So you have to make it in such a way. So here this is showing anxious, awful, confused, disoriented, frustrated, lonely, mad. Okay. So patient can touch and show you what is their feeling. This can be minimize the contact, direct contact. So when you're speaking through the protective mask, get the patient's attention by touching their shoulder or arm or locking eyes. So when patient may not hear what you are speaking or they may not understand what you are speaking because you are in the protective mask, speak loudly, slowly and distinctly. Establish clear yes or no signal like head nod, your shake, thumb up. So patient should understand what you are telling. If you are using some signal, it should be uniform in the ward. Like if a particular ward, all the nurses will come in different shift and they will communicate patient in different way. It will be frustrating the patient. So make a common signal, discuss among yourself and make a common signal. If showing thumbs up, it's okay. Like it's right. So you have to have a common language to protect your patients or relieving their stress of not understanding what you are communicating. And post a sign that all providers know yes or no signal, as I have told. Speak in simple phrases like a television announcer. Don't use big sentences. Tell patient to take water. For example, take water. Don't tell that you are going to dehydration. It's important to take water. So you can reduce the sentence length. Repeat important words. Use visuals like point and gesture. Keywords or phrases with bullet points on a paper you can write and show your patient. Points to picture or phrases on a communication board. Why am I telling this? When you can't hear patient, you will go very close to the patient with your ears, and you may try to keep your ears near patient's mouth. So it also sometimes make you contaminated. And trend of more shift on duty with less duration. We may have to focus to reduce the hours in a shift, because a nurse in PPE, it's very tough to be in PPE. When you are wearing it only, you can understand. We are telling to provide PPE, but a person inside is struggling, but it's very necessary also. So workload increases during pandemic time. Stress of working with threat of personal harm from caring from patients. So it's tough to be in PPE and work with usual duty hours. So our 3 shift or 2 shift has to be changed to more shift, and so we may need double the number of staff. So this is one of my students. He was I was his MSc teacher, and on the first day on PPE, he was very happy with enthusiasm. He went to hospital. He's from one of the important hospitals in North India, and he's seeing his status next day. I asked, "Are you on duty?" Then he sent me a message. It was watered my eye. Yes, ma'am. This is screenshot of his message. 8 to 8 duty for 7 days. And none among us can't wear this type of PPE for 2 hours. Feel like burning head to foot. Have to take at least 2 liters ORS to compensate that much of dehydration. This is a screenshot what he has sent. I was stuck for an hour and I couldn't talk because see how much they are struggling and people are not understanding what's their worth. So they are doing a lot of job, a lot of compassion, a lot of, so we, society or the administrative people have to support them, then only they can move. That's why their health is coming down. Then if nobody is addressing their issue, how they will improve in their life. Their status, first of all, most of the nurses are not thinking about the salary. They're doing a lot of work thinking about patient and compassion. So it's our duty to support them. So this is just to show you their struggle. This is only one nurse's struggle. Many are struggling in PP and on duty, as many of our speakers have spoken. And Dr. Krishomar sir has rightly suggested what all things has to be done. It's not just a speech. He's my director and he do whatever way he can comfort his staff. It's a life only have spoken. Like Gandhiji has told, my life is my message. And improve your immunity is important. These are very least considering their health. You have to improve your immunity and you know who you are. So you take care. And if possible, go for personal therapy. Even if it's suggested most of the psychologists to go for personal therapy. Go for personal therapy. Personal therapy is essential for any therapist. Excuse me. Can you mute there? Mute on. I can hear. Okay. Go for personal therapy. Don't feel bad when you are going. If you are going for personal therapy, it's something. Or don't feel bad to go for personal therapy. If you feel you need support, you can approach a person or healthcare professional who is doing counseling or who is a psychologist. Don't feel bad. So it's essential because you are always in a stress and storm area. You are working in a charged environment. You need support. If you are not supporting yourself, who else will do? So better to go for personal therapy. Even a very expert also go for personal therapy. Some nurses are stressed and concerned, making it difficult for them to console concerned patients. We know every day seeing this pain, death, and it may be distressing. So better to go for personal therapy. You can see a picture that self-care is not lazy or selfish. Self-care is healthy. Self-care is important. Self-care is necessary. And another thing, we should be a bit more focusing on the documentation than before. Like vectors of the virus, if we have moved some tablets from one patient's room to another, we have to record from this patient's room to this patient room, this thing has moved. paper and writing utensils used for how many rooms. So logs of visitors, these also in future we have to keep. We don't know what type of virus and what type of infections are waiting for us. So be careful and be prepared. And the three main changes have to come in nursing practice is modify the existing practices. It is tough because it's become a habit for us. Some of the techniques, it has to be modified. Like we can't expect a student sitting at home and or a doctor is sitting in a clinic and a patient is meeting online. We can't expect, but when it was a need of the hour, we do it. So some modification in the service is needed. Some things have to be deleted, like if a person is a healthcare professional or a nurse is going to bedside of one patient, checking temperature, and same things are used for next patient. So sometimes some practices have to be deleted, and we may have to have adequate number of amenities in caring patients and add new. So now we know that government has Kerala government has central government has e-Sanjeevani. So that we can sit at home and we can undergo consultation by a doctor, and patient can undergo consultation by a doctor. Even online prescriptions can be given, online counseling can be given. No need to reach to the doctor. So reaching the unreached is practiced through e-Sanjeevani. So sometimes we may have to add new. So modify, delete, or add new are the techniques essential for moving forward. In conclusion, we need to get into the mindset that it's going to take some time to come out of this pandemic. This is given by Maria Kirkov, epidemiologist, WHO. So we have to learn to live with virus. So you like it or not, you have to move with corona. Coronavirus will be here. We don't know when it will be vanished or when we are going to eradicate, when the vaccine will come. So we have to empower ourselves, and more solution focused you should be. What you can do. We may not be focusing. We don't focus much on the problem or death happens, this, that. What we can do from this negative situation, what else we can do. So focus more on solution focused approach. And I say again, I proclaim, take care of yourself, help yourself before helping others. When flying, you can understand the instructions are given. Place your oxygen mask on yourself first before helping small children or others who may need assistance. If you are there only, a healthcare, you can provide healthcare to many. Many people will be protected from death, and many people will be protected from illness. So please take care of yourself, improve your immunity, improve your mental health. So you may have to take care of yourself. As I have told, if don't mind to go for a personal therapy. Thank you so much. So the world is not the same. Get prepared. Thank you so much for patient listening.
Thank you, Reena. Sorry for the interruption. Thank you, Reena. We shall hear how the COVID-19 situation was tackled in different areas of practice by nurses at different levels. Now, sharing of experience during by the frontline nurses and nursing faculties who are involved in various COVID-19 containment activities. May I invite Dr. Usha Vike, Principal in Charge, Government College of Nursing, Kottayam. Welcome you, ma'am.
Hello. Hello.
Yes, ma'am, you are audible now.
Okay. Hello.
Ma'am, you are audible. Please talk.
Okay. So, can you see the slides? Hello. Can you see the slides?
Usha madam, is it audible?
Yeah. Can you see my slides? Hello. Hello. Hello.
Ma'am, you can share your screen, ma'am.
Hello.
Ma'am, you can share your screen now, ma'am.
Can you see my slides?
No, ma'am. You have to open the share screen first.
Hello.
Ma'am, please open that
Hello.
share screen.
Can you see my slides?
No, ma'am.
Hello.
എന്റെ ബാറ്ററി തീർന്നു എടുത്തത് ഇതിൽ കയറാൻ പറ്റുമോ? പോവാം. 9-1. എടുക്കാമായിരുന്നു. ഹലോ.
Yes, ma'am. Now you are visible. Now you can talk, ma'am. You can share your video and talk. Share your presentations.
Hello. My slides and in mail.
ഇത്
Can you play from there?
slide share.
Hello. Jayanti.
ഇതെല്ലാം പോയി.
Hello. Can you share?
ഷെയർ ചെയ്യാൻ പറയും.
എന്താ പറയാ നിങ്ങളുടെ ബാങ്ക് വെച്ചാൽ
Hello. Can you see my slide?
Yes, ma'am. Please continue.
Okay.
Yes.
So, sorry for the interruption. First of all, I appreciate and congratulate the one and all behind the curtain. I'm very happy to share our experiences in the prevention and control activities of COVID-19 coordinated by the Government College of Nursing, Kottayam.
Hello.
Yes, ma'am. Please proceed.
So, COVID-19 prevention and control activities. The first positive case of COVID-19 arrived from Italy and got admitted at Government Medical College Hospital, Kottayam on 8th March 2020. And their aged parents, 96 years and 88 years old, were got admitted in this hospital on 9th March 2020. All of them got cured and got discharged on March 18th and 4th April 2020 respectively. One of the staff nurses cared the aged parents in ICU, got infected and admitted on 24th March 2020. The parents got discharged on 4th April 2020. The initiatives for the prevention and control of COVID-19 are coordinated from Government College of Nursing College, Kottayam are at the institutional level as part of the Break the Chain program. Arranged hand washing facility in front of the college, kept hand sanitizer in various entry points, college, office, library, mess, etc. Thermal scanning for all the people entering to college. Wearing of face mask made compulsory to everyone. Visitors' diary strictly maintained at the front office. Then cloth masks were distributed among students and facility and faculty. Then we have already also handed over 3-layer mask to the nursing officer, Government Medical College Hospital, Kottayam. And we have made available our college bus for the staff transportation of the staff nurses at Government Medical College Hospital, Kottayam. And also one more floor of the hostel, students' hostel, was reserved for the accommodation of staff nurses. At the community level, the faculty and students organized various activities like one is Corona Help Desk at Primary Health Center, Etumanur and Adiramvida. Home quarantine monitoring, follow-up and reporting. Visit to migrant camps and provided Corona prevention education, including demonstration of hand washing, wearing of face masks and social distancing. Contact tracing through phone calls. Screening of interstate passengers. Also, the students and faculty participated in integrated disease surveillance project program and assisting with the maintenance of surveillance records, home visiting and providing counseling to people in the neighborhood of families under quarantine, packing medicines for NCD clients and sending through proxies. Dr. Veetilekku, Hello Doctor program implemented by Etumanur PHC in collaboration with Etumanur municipality. Initiatives for the initiatives at a hospital level are continuing health education activities on hand hygiene, proper use of face mask, importance of social distancing, management of minor symptoms and prevention of COVID-19 for people attending various departments in Medical College Hospital. Faculty and students actively participated in Break the Chain campaign and educated the same to the patients and relatives. Prepared and distributed an information leaflet on COVID-19 and its preventive measures for the public. Conducted an awareness program on myths and facts about COVID-19 and its prevention. Demonstration of donning and doffing of personal protective equipments for the staff nurses. prepared an information booklet on corona and mental health in Malayalam and uploaded in Facebook and WhatsApp. Conducted an awareness program on corona and mental health for the staff, patients, and family members of psychiatric ward MCH. Telephonic counseling to COVID positive cases in collaboration with the psychiatric department. Prepared an information leaflet on facts and precautions of COVID-19 in Malayalam and distributed to general public. As a token of gratitude, token of expression of gratitude, our final year BS Nursing students designed posters for appreciating the nurses' contribution in COVID control and uploaded these posters in website. And with that, lot of COVID-19 prevention and control activities are continuing in our college with a joint venture of students, PG students and faculty and our UG students. Thank you all. I'm really sorry for the video for not possible to upload the videos. മറിയാമ്മയുടെ അതിനകത്ത് സ്ക്രീൻ മൂവ് ചെയ്യുന്നില്ല ആണ്.
Okay, thank you.
Jayanti madam, can you unmute? Jayanti madam, can you unmute?
Okay.
Yeah, it's audible.
Okay. Thank you, madam. I call upon Mr. Riaz, Assistant Professor, Government College of Nursing, Thrissur. May I invite Mr. Riaz, please.
Riaz is not online now. You can call upon another presenter. I think Joseph Jennings is available.
Okay, okay. Joseph Jennings, staff nurse, Government Medical College, Thiruvananthapuram, who has experience working with COVID-19 in ICU. I invite Joseph Jennings.
Hello, everyone. Is it audible?
It's audible, Jennings. Continue.
Can you share the PowerPoint for me?
Yeah,
because
sure.
I am at hostel.
Okay. Nabil, can you share the PowerPoint?
Okay, 1 minute. I will share. 1 minute.
Sorry,
Nabil, can you share the?
Okay, I am sharing. 1 minute. 1 minute.
Is it visible? Screen? Yeah, it's visible. It's visible.
Yes, yes.
Hello, good evening to all. Myself, Joseph Jennings MM. I am working as a registered nurse at Government Medical College Hospital, Thiruvananthapuram. Can you share the first slide of the PowerPoint? Okay. First of all, I am very much thankful to Professor Ponnamma, Madam, as well as all the team from Government College of Nursing, Calicut, giving me a chance to share my experience of COVID duty. I'm doing this COVID duty for the last 5 months. And now also I am posted at COVID positive ICU at Medical College Hospital, Thiruvananthapuram. And this is the third day of my current duty schedule. And I have some experience at Medical College Hospital, Kasaragod. And we are the first team went to the Medical College Hospital, Kasaragod to make a special isolation unit at Kasaragod. So we moved on the 5th of April 2020 and made a 40-bedded isolation unit. And myself and my friend, Mr. Praveen, we are the first nurses doing the first duty at Medical College Hospital, Kasaragod. And we had given treatment for the patients. Around 15 patients we had treated, and we had done telephonic counseling. And we done motivation sessions in every morning. We started rehabilitation programs and maintaining good rapport with the Directorate of Health Service team. And we had a 10-member of nursing team, mostly the male nurses, and a very good support from the doctors as well as other team. So these are the experience, and we discharged 5 patients at Medical College Hospital, Kasaragod. Next slide, please. Hello, next slide. Next slide, please. So next, I am going to present what are the challenges now I am facing during the COVID duty, because I am posted for the 4th continuous rotation duty on this COVID scenario. So the main challenges we are facing, that is the mental stress because of the family separation, frequent duty in the COVID areas, the stress during caring of patients, especially in the negative and suspected ICU, because we are fear whether the patients, when the patients become positive or not, the work pressure from the authorities, and inadequate support system during duty and during quarantine. So as of all, we are suffering a great mental stress during this COVID duty. Next slide, please. Next, about the physical problems. The most important physical problem that I face during COVID duty is the fluid depletion, because wearing of this PPE for continuous 4 to 6 hours for the duty, it can create a lot of fluid depletion and electrolyte imbalances for the staff nurses as well as the healthcare workers who are wearing the personal protective equipments. The skin problems and allergic reactions due to the excessive perspirations. Most of the staff nurses are complaining of fungal infections and the exposure risk. Even though we are wearing this PPE for a long period of time, we are not protective because most of the patients on ventilators, we are doing open section. So at that time also we are at great risk during caring of the patients, and the problems faced by the female healthcare workers, especially the female workers, those who are in menstruation. They are also suffering a lot of problems during this COVID duty, and also the problems with diabetes mellitus and hypertension. So these are the common physical problems we are facing during this COVID duty. Next slide. So the third and the most important problem we are facing during this COVID duty is the inadequate logistics. First, about the inadequate manpower. So for this continuous corona duty and also for the non-COVID duty, we need a lot of manpower, especially the nursing staff, other healthcare workers. We need a lot of staff for posting in the COVID as well as non-COVID duty. So inadequate manpower in the medical college itself is a great risk as well as a great stress for all of us. And poor quality of supplies. During the initial period, we are getting a standardized personal protective equipments in the initial period. But nowadays, due to the poor quality of the supplies that we are getting, that's because of the poor quality of supplies, we are at the risk of developing fluid depletion and dehydration, as well as so many problems we are facing due to the poor quality of supplies, especially for the personal protective equipments. Next, about the donning and doffing area maintenance. Because of the immediate shifting of one ICU from another ICU and also from one ICU, from one ward to another ward for making COVID wards as well as COVID ICUs. We have inadequate donning and doffing area. And also because of the maintenance, inadequate maintenance, we are struggling with the doffing strategies because most of the time there will be a breach at the doffing area. So there is a lot of chance to get infection for the staff nurses at the doffing area. Inadequate training of staff on ventilator and ICU management. Nowadays, the positive patients are increasing nowadays. So the persons who are working in the ICU should have adequate knowledge regarding how to manage the ICU patients, how to manage the equipments in the ICUs, and how to manage the ventilator in the ICUs. And last, about the improper staff allocation. So before the COVID duty, most of the staff nurses, some staff nurses will be working on the ICU, some in the ward areas. But in the management level, due to the improper staff allocation, some people working in the ward area are coming to the COVID ICU. So they don't know about how to manage the ICU patients as well as the ventilator. So this will create a lot of mental stress for the staff as well as for all of us. So inadequate logistics is a very important challenge we are facing. So these are the common challenges: physical, mental stress, and inadequate logistics. So one thing I can assure that most of the staff nurses are struggling with the COVID duty, and most of the healthcare workers they are living at the hostel inside the hospital campus itself. A lot of the staff nurses as well as healthcare workers, they don't go, move to the home itself, and they're facing a lot of mental stress, a lot of physical stress during this COVID period. We need immense as well as adequate support from all other people. And thanking again to all the people who are working behind this session. Thanking you all. Thank you, madam.
Jayanti madam, now I think Dr. Rias is online.
Thank you. Joseph Janice. Thank you, Joseph Janice. Next, Mr. Jitin Thomas. Now I call upon Mr. Riaz, Assistant Professor, Department of Psychiatric Nursing, Government College of Nursing, Thrissur.
Thank you, ma'am. Thank you. Okay. So first, shall I start?
Yeah, can you share your video? Yeah, it's okay.
Okay. So if somebody asks me to sum up all these, my session in one word, I can say how, what, and why. So the experience what I am right now having with this COVID-19 is related to how I am living with COVID, what I am learning with COVID, or learning about COVID, why I am leading against COVID. These are the three important things that I would like to share, because as a nurse educator, I am very well in contact with those who are working with this one, with the COVID. So this slide explains about exactly the framework of my discussion. That is, the COVID-19 people, or those who are working with COVID-19, the nurses who are working with the COVID-19 are currently involved in these 4 circles. First one is complicated experts. Next slide. Could you please say, yes, yeah. So for the nurses who are working right now in COVID-19, patients with COVID-19 are under in these 4 circles. First one is complicated experts. As we know, the people who are giving information, that is advices that we are getting from day one to right now, it is complicated because day by day new changes are taking place, new ideas are coming, new advices are coming for the nurses. So they are in complicated with the complicated experts. Next one is complex emergencies, because sometimes it can see that those who are working with the patients, suddenly things are changing or new complex situations are arising. Next one is chaotic rapid response. That is also there. That is, suddenly we need to change, as just before Joseph Jennings was telling, suddenly we need to change the ICU. Suddenly we need to move on to one area to another. Suddenly we need to move on with one treatment regime to another. And finally, it is the simple best practice nurse. So this 4 circles explains what exactly or where exactly a nurse is lying right now. With regard to this one, Kerala University of Health Sciences is conducting one project with patients or nurses who are working with the COVID. From that experience, that is, I already finished my pilot study related to that. I could come across with the problems what nurses are experiencing. That is anxiety. Anxiety, this is with regard to their sharing experience, and it's a qualitative part of study what I am right now doing. That is, in that one, I could find out that nurses who are working really anxious. Initially, they were anxious about their own health, but now they are not that much bothered about their own health. Now they are more bothered about their family's health, others' health. So that is the first theme I could identify in that one. Second one is drop in confidence level. Initially, the nurses were not that much confident, but later on, their confidence level grown upwards. But now their confidence level are coming back because the number of cases are increasing day by day. It is associated with individuals, problem associated with individual, problems associated with system. That is also there. Initially, our system was almost like a foolproof, but now the things are changing and the system has got its own demerits. And that is also causing a drop in confidence from the part of nurses. Then society. Our society nowadays behaving like anything. Initially, we were really conscious about the aftermaths of this COVID-19, But our society members, so people who are in the society, are not showing that much integrity, or they are not showing that much seriousness with the suggestions given by the health ministry. So that leads to drop out in the confidence level of nurses. The next theme, what I identified, is helplessness. Really, it is associated with the loss of control. Initially, I already explained that is initially we were in control of the situation, but day by day the things are going out of our hand. And recently, the nurses are explaining that it is going out of their control. That shows they are helpless with regard to current scenario. Then dealing with the anger, that is mainly associated with others' actions are causing problem. The nurses who are working with the patients are facing problems related to relatives, public, and that itself is creating problem. And that dealing with anger is another problem that I could identify in that pilot study. Then, of course, grief and guilt. Grief is about the loss of health, loss of time, loss of resources, loss of abilities, loss of attitude, loss of connection, and loss of plan. So these all things leads to grief reaction, and the problem nurses currently experienced by nurses are really associated with this delayed grief or complicated type of grief. Many nurses with whom I conducted this interview could identify that they are experiencing abnormal grief reaction. Then, of course, another problem expressed by nurses are guilt. That is regarding spread of illness. How far they are causing problem, they are creating spread of illness. That is, they not able to do what they want. That is another theme that I could identify. Nurses are not able to perform what they exactly can do. Then wanting to do. Hello. They don't want to do what they can do. That is another thing. Then lack of empathy. Initially, nurses were with ample amount of empathy among them, but now we can see the empathy level. It is because of the increased workload. They are experiencing reduced empathy. Then they are not able to cope up with properly. So these are some of the areas that we can identify as this post-stress problem associated with the current situation. Now we can move on to, from my study, I could identify certain self-care obstacles, attitudinal problem that can elicit from the part of nurses. That is, first one is, few of the nurses said it would be selfish if I am take a break. So it is because of the blame that he or she may get from the outside. They are showing that they are saying that they may feel like they are selfish. Then another point that I could identify, that others are working hard, so I have to work. Even though even though the nurses are well equipped with all these facilities, but now they are feeling that they have to work only because they are really exhausted, but they are saying that they are working hard because they should work hard. That is the reason they are working. Then another theme I could identify, that I am okay, fine, not tired. Few nurses told that I can work, I can do whatever I want, I can work whatever level I can. That is the thing they are expressing. Then another theme I could identify is others' needs are important than mine. That is why I am working. Because being a nurse, I can do wonders. I am the warrior in the forefront of this COVID-19 fighting. So definitely I can do a lot. That is why I am working. I am not doing enough. Many nurses expressed that feeling that I can do much better. We could see some of the nurses who went for this quarantine and who got this COVID infection, and afterwards also they are working. And that is amazing explanation or expression I could see from the nurses. Then many nurses told that I can do more. That concept is also there. I can do more. Then some of the nurses told, I don't want others to know how much I am struggling. They want to hide their struggle. They want to give a false information, false identity that they can do much work. Actually, they are exhausted very much. And only I can do that feeling also there. I am a trained nurse. Because of that, I can do this fighting. I am the right person to fight. That is also there from the part of many of the nurses who are working in this COVID area. And some of the behavioral problem I could identify from the nurses are they are working too long. That is, the duty schedules are very high and many a time they have to wear this PPE kit for a long time. That is creating problem. That is they keeping stress to oneself. They are inwardly taking this stress and anxiety, and it in turn will result in problem later on. Physical problem can arise for the nurses. Then some of the nurses are expressing that they are experiencing inflexibility from the part of their seniors. They are strict and they are showing that inflexibility. That is also there. And few nurses reported that they are relying on alcohol. That is very amazing information that I got from this study. That is, the nurses, few of the nurses explained that they are depending on this alcohol for reducing their stress level. And one more important area I could identify is moral injury. That is, it's a new terminology, new idea that I am getting from this pilot part of my study. That is moral injury. And according to that, they are telling that life and death, a triage or resource decision. That is what they are telling that is actually the triage process is only to save the resources we are doing. That is a moral injury, and that many nurses explained that type of explanation, knowing that under what circumstances a person's life could have been saved. That is, many nurses say that if the situation was a different one, I could have saved the life of that individual. I could have saved that condition of that individual. That is also expressed by few of the nurses. Then some of the nurses explained that not working to work for a danger situations. Actually, they want to work, but they are not able to work properly in that situation. See, these are some of the moral injury that I could identify from the part of these nurses. And finally, I am concluding this one. That is, I could suggest 7 C's for dealing this problem. Those nurses who are working with these COVID patients can focus on these 7 C's. First C, check. Second one is coordinates. Next, cover. Next one is calm, connect, competence, and confidence. So first one is check. Check means assess, observe, and listen what exactly they are feeling. They themselves has to see themselves and identify how much they are in a problematic situation. They need to observe themselves. They need to listen their own thoughts. That is the first C. Second one is coordinate. Coordinate, get help from wherever they are getting this help and refer themselves to a higher mental authority, higher authority, so that they can resolve their stress. Then cover. Many nurses are doing this one, and this cover is another C that a nurse can implement. Go for safety. That is cover. The next one is calm. Calm means relax, slow down, or refocus. These are the 3 relaxation or calming down technique a nurse can apply in this area. The next one is connect. Connect means get support from others and get support from those who are already working in this area. The next one is competence. Restore effectiveness by in-service education and sharing their experience. And this type of webinars are very well useful for controlling or improving their competence. And last one is confidence. If we can improve the confidence level, if we can restore the self-esteem of a nurse who are working with the patient who are affected with the COVID, definitely we can reduce the problem associated with the stress. So with that, these 7 C's, if we focus very well, we can control their stress and anxiety. With that, I am concluding. Thank you. Hello.
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 Thank you, Dr. Riaz. Mr. Jitin Thomas, a lecturer, College of Nursing, Institute of Liver and Biliary Disease, New Delhi. He has experience in teleconsultation for nurses. I invite Jitin Thomas.
Well, madam, can you hear me?
Yeah, sir. You are audible.
Yeah, thank you, sir. Actually, sir, the Riaz Khan, Dr. Riaz slide is.
Can you little bit raise your volume, sir?
Sir, Dr. Riaz PPT is already been shared, so I could not share from here. Hello. Okay, am I audible to all of you?
Yes, sir. Yes.
Okay, thank you. Well, to begin with, I express my sincere gratitude to Professor Panama ma'am for inviting me to talk on this well-organized international webinar, De-Stress, Minding, or let's talk about nurses' mental health during COVID-19. So I would be talking about journey of nurses, experiences from a tertiary care center from National Capital of India. And I myself, Jiten Thomas Parel, lecturer, College of Nursing, Institute of Liver and Biliary Sciences, New Delhi. So let's begin with my presentation or my experiences. So all of you are quite familiar with this diagram. This is nothing but Maslow's hierarchy of needs. So I'm going to explain in our institute. This is actually an institute which is comes under the National Capital Territory under Government of Delhi. So I'm going to discuss about in our institution how these motivational needs have been met for nurses. On the top of that, I also wanted to remind you, this is the year of nurses and midwives. And we, the nurses, are the frontline workers around the globe taking care of this COVID-19 pandemic. So taking care of ourselves is very important. So let us begin with the physiological things that our institution follows. So it largely depends on, three things like first, rest. Our staff gets adequate rest for their duty hours. Usually at the beginning of the COVID-19 pandemic, we have 7 duties plus 14 days quarantine. But at the COVID pandemic progresses and many of the nurses have infected, that policy has been changed from 7 days working and 7 days off. So they are getting adequate rest. And coming to the nutrition, actually our clinical nutritionist actually calculating the caloric requirements of every nurses according to their age, gender, etc. And it has been provided from the institute itself according to their caloric requirements. And elimination needs within the staff itself, they will be allowed to meet their elimination needs if they need it. So, and on the top of that, there is no problem with the PP as such. We have a lot of PPs in our institute. So there is no scarcity of resources. In fact, I also feel that while I'm communicating with the nurses, they also feel that sometimes to wear the PP is a very Herculean task. They may be profusely sweating after their long duty hours. So it is there, but still they are somehow adjusting with this duty, and they are moving ahead and taking care of their patients. And second one about safety. This is of utmost importance. Why? Because it's about already the speakers has already told that because of getting infection to oneself and contracting illness to their loved and near ones. So here, I already told PP, they have adequate PP, hand sanitizers, and every facility in our institute we are giving. And we are often giving the prophylactic drugs also, even though there is no conclusive evidence. But as per the ICMR recommendations, we have given to whosoever necessary. It's not, giving it as a mandatory protocol, but whosoever willing to take, they are being given this hydroxychloroquine for our employees from top to bottom to everyone. And coming to the love and belongingness, love and belongingness is actually the thing that binds all the nurses together. So for that, WHO has also recommended about the buddy system. Buddy system means we are taking care as a team. That means, we are collaborating with other nurses in our same ward, with the peer groups. Sometimes a peer group themselves can talk and clarify their problems. So that is being done. If that is not being clear at that level, then it moves to the immediate supervisors, then to the in charges, and to the nurse manager. So this is actually the protocol we are following in our institute. And we have teleconsultation services also. We have a separate WhatsApp group for nurses, and we have in between these sessions virtually meetings conducted in a week if possible. So these are all about the love and belongingness. When it comes to the esteem, self-esteem, self-esteem is largely dependent on their confidence, because at the beginning, even in ILBS, we conducted a survey called Field COVID survey. So we have done it in patients as well as in nurses. In nurses, we have conducted around 1,300 nurses among all the country, and we could found that among 1/3 of the person has depression, anxiety, and stress. Again, I'm telling you, this is not a clinical diagnosis. This is being largely diagnosed through a tool called Depression Anxiety Stress Scale, DAS-21. So in that tool, it comes to be like 1/3 of the nurses has this kind of problems. This too has done at the beginning of the COVID pandemic. The result may vary if you are doing it again. Right. So to build their self-esteem, we have done this, and also we have an to build the self-esteem. We have also conducting online courses, nurses across the world. We have an online course called Empowering Corona Warriors Task Force in ILBS. We have already trained more than 1,000 nurses across the globe, and the 5th batch is also on the go. It is also been soon be registered, and it will be beginning at the next week. So this is how we develop our self-esteem among nurses, and also we are also giving psychological first aid. That means at different administrative level, they're listening to the nurses' problem, and they're solving then and there. And this is also a designated center for first plasma bank, which is being designed in the country. That is also a proud moment as an institute, being the part of the institute. And more importantly, why I'm telling you is, if you see the plasma donations, even at the beginning, nurses are at the front line to donate the plasma, because of those who are recovered from the COVID pandemic, they are very ready to give the plasma, convalescent plasma, to the plasma bank. So self-actualization, theoretically speaking, self-actualization is achieved largely when you are at an older age. You have fulfilled your personal and professional life. There comes the self-actualization. For in your younger days, you may not achieve self-actualization. So it's on the way. I hope if you are meeting all these things, you will be reaching the self-actualization also. In our institute, how to take care of yourself, from my experience and from my hospital's experience. So person-directed. Mind you, you are the very VIPs in your life. Patients are equally important, but you should be taking care of your thing. One thing you need to do is spend time for yourself. Until and unless you're not giving time to yourself, then there's a big problem. And don't buy any panic from others. And also, you should not give panic also. So you need to be really happy. You should be physically active also. These are the things, at the institution level, there are limitations, but at the personal level, there are a lot of things that you can do. And remember, control the controllables. There are thousands of things happening all around the world, like the mortality is increasing, the COVID positive persons are increasing, doesn't matter. But what you are doing is really important when it comes to the person-directed approach. Then organization directed, I have already told to you. And when you're balancing, you need to build your resilience system. Once you build your resilience system by personal directed and organization directed, you can be a frontline warrior, and you can beat any obstacles that comes to our workforce. So I am really proud of being a nurse in the current scenario amidst the COVID pandemic, because we are actually genuinely contributing too much to the society. Personally, I am also involved in COVID-19 care. Like, I am also now integrating the clinical services. I mean, I am posted in COVID-19 ward. We do get samples from outside hospitals, and in fact, we are checking the ICMR portal for their criteria, and it get tested. The report has been dispatched. In a way, we are also contributing to the society. So that is it all about my presentation. But one take-home message I wanted to share with you all: every situation in life is temporary. So when life is good, make sure you enjoy it and receive it fully. And when life is not so good, remember that it will not last forever. And better days are on the way. Take care of yourself. That's all from my side. Thanks a lot for inviting me to speak onto this occasion. And it has been well organized. Thanks a lot.
Thank you, Mr. Jiten Thomas. Mr. Jiten Kannan, staff nurse, Government Medical College, Kozhikode. He has experience in the isolation ward and in charge of infection control unit. I invite Jitin.
Hi, Jidin, can you start your video?
Yes, sir. Am I audible?
Yeah, you're audible.
Okay. I'm very thankful to Professor Panama K.M., Principal, Government College of Nursing, and faculties over there who are working behind this. Thank you, madam. And now let me begin. Now I want to share about my experience, COVID-19 pandemic experience. So problems like I have just made a like we know that there is no definite treatment guidelines. It keeps on changing in a pandemic. It makes like also the thoughts about our family. Like I have been separated from my family for the past 4 months. I have been separated, so I haven't yet gone there, and my sister also have went to Dubai for her work. So I have been separated. So a little bit of problem I am facing right now because how they are there, and also the patients under control. Here, 2 days before, we had a patient who was brought in an ambulance. He was so agitated and violent. No one were able to control him. So the scenario, like no one were willing to get into the ambulance and give a sedation. So what we were doing now, the people here, like me and Mr. Shabir was there, we all came here, just go through this initiative and the willingness, with the volunteership, we have just gone inside the ambulance and given. So in this case, we will not be having a specific task or we will not be having specific duties. At what time we have to perform, act accordingly, some kind of stress will be there. If the patient was still in the ambulance, it will be additionally causing stress for the staff here. So when I was posted into a new area, I was like at a late, like it was my call was at around 10:30 in the midnight. I was asked to take a duty in the COVID isolation area. So it was late 10:30 a.m. I was not having any further information at that point of time. I was joining in the late night duty, and I was starting with the night duty without any initial idea about the isolation ward. So I was stepping into that without any prior information. So it caused me a certain kind of stress. So the co-work and peer groups here, we have many co-workers here and the peer group here. So many of them, certain kinds of the discussions going between and the peer group support or no supporting, like they will tell like how far you will be working like this. If for the past 4 months you are here, but the thing, some people, some of my good friends are still supporting me to be there, and they are still working. And the odd times also I need to work there. So no specific time for me. So like I enjoy it right now, but the stress was like this. Stresses was like this. And the other thing, as the previous speakers have told, like, will it spread to the others? Now the recent informations are coming up, it will be spreading by airborne. So things getting into our mind, like whether I will be making others getting this particular disease, it all makes some kind of problems. So that's why I mean to need to be separated from the neighbors even, and also the getting in ICU, like when the patients are getting in, whether the particular patients need extra care and extra space to be kept in, we need an additional ICU. Recently, we have been within 2 to 3 days, we were urgently making a new ICU setup, that to a ward. You can all can understand a government setup, a government ward to be converted into an ICU. It will be having a hectic task, and to run behind it is also a hectic task. And being a staff nurse, it was really big stress for me, like whether after completing this particular task and being a junior, will I be able to succeed? So I really, I am very grateful to all the faculties over there. Because of my graduation, post graduation, I was able to get all kind of support from these people there. And also the rotational duties, one thing I need to make it clear, that when there is a rotational duty, no staff will be a fixed there. See, it also create certain kind of stress all over. So some kind of link nurses here in our hospital. We have specific link nurses like me. There are specifically, we are 4 of them, and we are still continuing our duties.
Excuse me, Jidin, can you share your screen? Your presentations are not visible.
Okay, sorry, sir. Sharing is not sharing. I hope so. Is it visible, sir? Is it visible?
No, no, it's not visible. There's a green button there.
Yeah.
Share screen.
Yes, sir.
Just click on it and choose your presentation and share. Yeah, now it's okay. Now you can go to the slide share. So not presentation mode.
Now okay?
Yeah, correct. Yeah, it's okay.
Okay, sorry for that. Okay, so the rotational duty. So I recommend if some people are there still continuing, it will be better. Especially people are there. So some kind of stress we can reduce in that area. So the equipments and supplies here now we can't tell what the people are demanding. Some kinds of demands which we can't even met them. Like on basic needs we are looking at food and medicines for the specifically for the COVID we are providing. But additional things, it keeps on changing, and it's also causing stress for the staff. Like when we are not giving a specific thing to the patient, he will be getting agitated and getting violent, and he may be behaving some other way. So this all things will be making us also in trouble. Now visible in the slides. Slides are visible, right? So this is a pyramid. So here the PP, whether the PP is good and appropriate for giving a good amount of protection, and the workload and the patients attending staff. Like we have made our certain rooms we have created in a way that the psychiatric patients can be kept in. Like we have removed the fan inside that particular room, and for a close monitoring we are keeping the extra staff for that attendance we are keeping. So this all the things what we have done specifically for this kind of problems what we have faced. And certainly also the introduction of new biomedical equipments. Now we have been introduced with high flow nasal cannula, some machines. So these machines and all the disinfection methods are entirely different from what we are. All the traditional method is not suitable for this particular machine. So these all things will need additional skills, and the new staffs who are coming for this particular task are getting very much they are getting some kind of stress. So we are providing continuing educations for them, and also the less studies and articles regarding the infection control in the COVID-19 pandemic. So we are now having less studies regarding how this disease. Now new updates are coming, like it can be also concentrated on the airborne and all. So this all create like no new learnings or no studies are coming. So this all things create some kind of stress in the staffs. And also the demand mismatch, what I have said, like the patient demanding something and what we cannot meet it. So this all create additional stress for all the staff nurses working in an isolation area. And also I'm skipping like that what we get from this, like what after getting a duty, how we can find some relief. So I have been WhatsApp, like I have got a message from one of the patient's brother. Like he was like so thankful to us for being so caring for that patient. This all things now when we are reading it, when we are at home, or when it has been shared by someone to us, so we are so happy, and this all things will create a relief in our mind. So and also we can like if there is some online yoga training, yeah, we know that in YouTube we have plenty of yoga training. But if it is making it is a mandatory for all the healthcare providers, if it is a mandatory and they have to get it, or they have to undergo that, like if that is there, so some kind of stress can be relieved, and we all the other administrators can ensure that their staffs are getting some kind of relieving techniques or the meditation. If they are willingly, they can listen to the music and engage them into their favorite hobbies if they are getting time in the leave periods, when after their corona duties and all can leave their mind. So I'm just going into skipping so fast. I hope I was audible and the slides were clear. It's all about the presentation, about my experience. Hope it was audible and the slides were clear. Thank you. Thank you for giving me this platform. Thank you, Professor Pannamam KM, Madam, and all the faculties over there and all the panelists, experts on this other side. Thank you so much for giving me and for the patient listening. Is it audible? And also one point I want to add on, please. One point. So I was so thankful to the Government College of Nursing here because now everything we are able to discuss about. So the gap was there previously, but now nowadays we were working together. And I was so thankful to Dr. Sai sir and also Madam and everyone for giving a specific training to us all. So every time we are getting training and support from constant support from you all. So we are so thankful for that also. Thank you so much.
Thank you, Jidin Kannan. Thank you very much.
Okay, thank you.
Ms. Prabina, postgraduate student in our institution. She will share her experience. I invite Prabina.
Hello, ma'am. Hello. Can you see my slides?
Yes, yes.
Sir? Okay.
Can you keep it in slideshow and then start?
Okay, sir. Good evening, the panelists here. And myself, Prabina P. I'm representing the MSc Nursing students of the Government College of Nursing, Calicut. And first of all, thank you, ma'am, for giving opportunity for this occasion, presenting our concerns of during the COVID duty. And we were worked with the help desk duty both in the IMCH as well as the NMCH in the Medical College Calicut, and the surveillance duty at the Calicut District Collector Surveillance Cell as well as in the airport. Okay, in the 24-hour Corona help desk duty in the IMCH and NMCH, initially we were collected the history and initial details of the patient who were attending the OPD and attending all the phone calls from the patients as well as in the other persons, and also from the public relation officers and from the collectorate itself, and maintenance of all the registers, which including all the details of the whole details of the patients we were collected, and connecting from and to the isolation ward for various help from the isolation wards, and providing adequate direction to the patients as well as the relatives. And all the patients as well as the relatives, some having the not given the adequate direction, and we are providing adequate direction and help for these patients as well as the relative during our help desk duty. And the surveillance duty at the Kozhikode District Collector Surveillance Cell and airport duty. And in this, during this duty schedule, we were traced the contact from the domestic flights and the informed authority for the follow-up, and filtering all the contact list and finalizing the list of the people, list of the all the persons who are the residing in the Kozhikode district, and make the follow-up calls during this time. And there are so many psychological problems we were faced during this during our duty schedule. That's imposing self-quarantine from the friends and family, and the uncertainties to be on the help desk and feeling helpless at times. Sometimes we were helpless at the time, and we were on the duty, the help desk duty, and being overwhelmed with the thoughts, even on mild sore throat, and fear to go home, and stigma of the folk for being a hospital employee, and uncertain on the authenticity of the phone calls, and uncertain on the details to be shared by the phone calls, and the question of autonomy, and psychological distress when one of our friends went to quarantine. And also at the community level, we were work with the rapid response team, and also participate in the sentinel surveillance activity, and also provide adequate health education to the people in need. These all are the duties as well as the psychological distresses faced by as an MSc students in the college. Okay, thank you.
Okay, thank you, Prabina.
Thank you, ma'am.
It's the time for question, for the discussion of questions. We have received a couple of questions, but majority of the questions have been addressed in the session. Okay. One question, that is whether social media creates stress. The answer, whatever information that you are receiving through media, that should be wisely filtered for its relevance. So irrelevant information that may create stress. So better for our safety, so better to limit such form of information, that is receiving of information, that should be limited. That is my opinion. Thank you very much. Due to restriction of time, I am sorry, we have to move on. We have come to the close of this webinar. We hope this webinar will pave the way for new strategies to be implemented for nurses in the front line, helping them to improve their physical and mental health. The hosting unit would like to propose the vote of thanks. On behalf of principal and staff of College of Nursing, Kozhikode, I would like to thank Professor Dr. Leda R., former Joint Director of Nursing Education, for her inaugural address in the webinar. We are deeply grateful to all the eminent participants, all the eminent speakers of today's webinar in their valuable insights and sharing experience. The next, special thanks to all our participants who actively joined the webinar online. Thank you. Thank you, Dr. Professor Panama, madam. Thank you, one and all. Thank you very much. Bye.
Thank you, my faculty members. Thank you for being with me all through the program. Thank you very much.
Thank you, ma'am. Thank you very much.